Welcome, everyone. I'm excited to kick off our journey today with this presentation on yoga. Today's topic is simply titled Yoga, and it's a subject that offers a lot of benefits and insights. Throughout this session, we'll explore what yoga is, its history, key practices, and how it can enhance our well-being. So, let's get started and discover the world of yoga together. Let's take a closer look at what we mean by dexterity in action. This phrase highlights how agility and skill are not just abstract ideas, but are actively demonstrated through our processes. The phrase NIRANTAR emphasizes continuous, ongoing effort. It's about maintaining momentum without interruption. When we talk about long duration, we're focusing on the importance of sustained performance over extended periods, ensuring consistency and reliability. And finally, till life underscores that these qualities are not temporary. They are ingrained in our approach for the long haul, supporting our vision of enduring excellence. Together, these concepts reinforce the overall theme of our presentation, that true dexterity is about persistent, skillful action that endures throughout the lifetime of our efforts. Today, we gather on this auspicious occasion of International Day of Yoga, celebrated on June 21st, 2026. It's a special day dedicated to recognizing the profound benefits of yoga for health and well-being. I am Dr.Shefali, the president of Ayushkar, and I am honored to present to you a detailed study focusing on the impact of yogic therapy. Specifically, we'll delve into how yogic practices influence unexplained infertility as well as explained infertility. These are complex issues that affect many individuals and couples worldwide, and yoga offers a holistic approach to addressing them. Throughout this presentation, I want to highlight how yogic therapy can serve as a supplementary or alternative method in managing infertility, emphasizing its potential to restore balance and enhance reproductive health. Our overall theme underscores the power of yoga, not just as physical exercise, but as a comprehensive healing system. So, let's explore how this ancient practice can make a significant difference in modern health challenges like infertility. Let's take a closer look at female and male infertility. Both are significant factors contributing to reproductive challenges, and understanding them is key to addressing overall fertility issues. Female infertility can stem from various causes, such as ovulatory disorders, blockages in the fallopian tubes, or issues with the uterus. On the other hand, male infertility often involves problems like low sperm count, poor sperm motility, or abnormal sperm morphology. It's important to recognize that infertility isn't solely a female issue. Male factors play an equally vital role. When we consider the broader context of reproductive health, addressing both male and female infertility helps us develop more comprehensive treatment strategies. This holistic understanding is essential as we explore how to support couples in their journey toward parenthood. As a therapy in infertility, this slide highlights the vital role that various treatment options can play in helping couples conceive. When we talk about therapies, we're really referring to the different medical and assisted reproductive techniques designed to address the underlying causes of infertility. These therapies can range from medication-based treatments to more advanced procedures like in vitro fertilization. It's important to understand that choosing the right therapy depends on a thorough evaluation of both partners, including hormonal assessments and other diagnostic tests. The goal here is to tailor the treatment to the specific needs of the couple, optimizing their chances of success. By exploring these therapies, we're emphasizing that infertility isn't an insurmountable obstacle. With the right approach, support, and medical intervention, many couples can achieve their goal of having a family. This ties back to the overall theme of this presentation, which is about understanding and utilizing available options to overcome fertility challenges effectively. This slide doesn't contain enough information. That's why we're moving to the next slide. Today, I want to share with you a specific study that explores the impact of yogic therapy on infertility, both unexplained and explained cases. This study is particularly important because it sheds light on how traditional practices like yoga can play a role in addressing complex health issues such as infertility. Throughout the presentation, we've been emphasizing holistic approaches to health, and this is a perfect example of that philosophy in action. By examining how yogic therapy influences reproductive health, we aim to understand its potential as a complementary or even alternative option for couples struggling with infertility. So, let's look into what this study reveals about the effectiveness of yogic practices in this challenging area. Let's talk about male impotency, a topic that affects many men at some point in their lives. It's important to understand that this condition isn't just about the inability to achieve an erection. It can also involve issues with maintaining one or experiencing a lack of sexual desire. Male impotency can be caused by a variety of factors, including physical health issues like cardiovascular disease, diabetes, or hormonal imbalances. Psychological factors such as stress, anxiety, or depression also play a significant role. Lifestyle choices, like smoking, excessive alcohol consumption, and lack of exercise, can contribute as well. Recognizing the key points here is crucial because male impotency can impact overall quality of life, relationships, and mental health. It's not just a physical issue, but one that intersects with emotional and psychological well-being. Throughout this presentation, we're emphasizing the importance of understanding these interconnected factors. Addressing male impotency often requires a holistic approach, including medical evaluation, lifestyle modifications, and sometimes psychological support. So, as we move forward, keep in mind that male impotency is a common concern, but it's also one that can often be effectively managed with proper care and understanding. Let's take a moment to look at the aims and objectives of this presentation. First, our main goal is to clearly define what we want to achieve with this project or study. We want to make sure that everyone understands the purpose behind our work. Next, we aim to identify specific objectives that will guide our efforts and keep us focused. These objectives help us measure progress and ensure we're on track to meet our overall aims. It's important to connect these points to our broader theme, which is about advancing knowledge and creating practical solutions. By setting clear aims and objectives, we lay a solid foundation for the entire presentation and the work ahead. So, in essence, this slide helps us clarify what we're working toward and how we plan to get there. In this slide, I want to focus on the key aspects of our study regarding infertility. First, we aim to understand the causes of infertility in both females and males. It's important to recognize that infertility can stem from various factors affecting either partner, and identifying these is crucial for targeted therapy. Next, we will explore a conceptual description of infertility itself, along with how yogic therapy can positively influence patients facing this challenge. We'll look at different physical postures, breathing techniques, and various practices that can help improve reproductive health. We also consider how yogic therapy can be adapted for different cases of infertility based on age groups. Since age can influence the causes and treatment responses, tailoring practices accordingly is essential. Another vital aspect is examining the psychological impact of infertility on individuals and couples. The emotional and mental stress often accompanies infertility, and understanding this helps us develop more holistic approaches. Finally, our goal is to study how yoga therapy can help reduce or minimize the causes of infertility, ultimately creating a path toward happiness and well-being for couples. This comprehensive approach aims to combine physical, psychological, and holistic strategies to support those on their fertility journey. Let's explore the hypothesis we've developed for this study. First, we propose that an unhealthy lifestyle and diet can directly contribute to infertility. It's important to understand that our daily habits and nutritional choices play a significant role in reproductive health. Secondly, we believe that anatomical and physiological deficiencies, along with psychological conditions, are more responsible factors for infertility. These aspects can often be overlooked, but are crucial in understanding the complete picture. Finally, we hypothesize that yogic therapy and psychological counseling could be effective interventions. These approaches may help in reducing fertility-related complications by addressing both the physical and mental aspects involved. Overall, this hypothesis ties into our broader theme of exploring holistic and integrative approaches to improving fertility outcomes. The science of yoga is as old as civilization itself and has always been a part of a healthy and natural lifestyle. It's not just a set of physical exercises, it's a holistic approach to maintaining balance in our lives. Yoga has been used for both preserving health and for healing various ailments. You see, disease occurs when the elements within us become imbalanced, and yoga aims to restore that balance naturally. By adopting a yogic lifestyle, we can significantly reduce the chances of experiencing issues like infertility and other health problems. This is because yoga influences our physical, mental, and energetic states, promoting overall well-being. Now, if we look at the very beginning of human development, it all starts from this tiny cell. Out of this cell, the entire human body develops in the womb of the mother. The jiva, or the soul, along with the raja, which is the female ovum, and the shakra, the male sperm, come together to meet and give shape to new life. This process highlights the importance of balance and harmony at the most fundamental level. The second objective of this thesis is to explore and provide a conceptual understanding of infertility, as well as the effects of yogic therapy on patients facing infertility. We will look at various physical postures, breathing techniques, and other practices that can influence reproductive health. In this research, we see yoga as a life phenomenon in its totality. It's not just a practice, but a way of life that impacts every aspect of our being, especially in the context of health and healing. This holistic approach is central to understanding how yoga can serve as a powerful tool in addressing infertility and promoting overall health. Let's take a closer look at the various lifestyle and physiological factors that contribute to infertility. These include diet, which plays a crucial role in overall reproductive health. Poor nutrition or unhealthy eating habits can impact fertility in both men and women. Anatomical and physiological deficiencies are also significant. Things like dysmenorrhea, which refers to painful periods, or tubal blockages that prevent egg and sperm meeting. Then there's ovulation, a key process that must occur regularly for conception. Issues like PCOS or irregular menstruation can disrupt this process. Body mass index, or BMI, is another important factor. Being underweight or overweight can interfere with hormonal balance and ovulation. Semen analysis is critical when evaluating male fertility, as it provides insight into sperm quality and motility. All these factors intertwine to influence overall infertility risk. But it's not just physical factors. Psychological factors, such as stress, also play a vital role. High stress levels can disturb hormonal balance and impair reproductive functions. When we look at the problem of infertility in the modern era, we see that these lifestyle, anatomical, physiological, and psychological elements all interact and contribute to the increasing prevalence. Understanding these interconnected factors is essential for approaching infertility comprehensively and effectively. The infertility categories are essentially divided into two main parts, and we can visualize this clearly with a flow chart. As we look at this diagram, notice how it splits the causes into distinct pathways. The first part involves issues related to the female reproductive system, including factors like ovulatory dysfunction, tubal problems, or uterine abnormalities. The second part focuses on male factors, such as sperm quality and production issues. Understanding this division is crucial because it helps guide the diagnostic approach and treatment options. It emphasizes that infertility isn't just a single problem, but rather a spectrum of potential causes, which can be either female, male, or sometimes a combination of both. By categorizing infertility this way, we're better equipped to tailor interventions and provide targeted care, ultimately improving outcomes for couples trying to conceive. So, this flow chart isn't just a visual aid. It's a framework that underscores the importance of a comprehensive evaluation in infertility management. There are several reasons behind the declining birth and fertility rates, and this trend isn't limited to our country alone. It's a global phenomenon. One major factor is the increasing interest among women in education and pursuing careers, which often shifts focus away from starting a family at a younger age. Additionally, we see more late marriages and a rise in divorce rates, both of which can impact fertility patterns. Improvements in contraception and better access to family planning services have also played a significant role, giving couples more control over when and if they have children. This naturally leads to delayed childbearing, as women choose to wait until they feel ready or economically stable. As a result, family sizes tend to decrease, which again affects overall fertility rates. We also need to consider the impact of health factors, like miscarriages, which can influence reproductive outcomes. All of these elements are interconnected and reflect broader social changes, which we'll explore further as we discuss the epidemiology of infertility. Understanding these reasons helps us see the bigger picture of reproductive health trends worldwide. So, the entire process of conception really hinges on the functional ability of both the husband and wife. It's important to remember that the anatomy of the couple's genital organs must remain normal for this to happen smoothly. And crucially, we need to investigate the couple as a whole for any defects, because issues in either partner can impact fertility. Now, in a normal, healthy scenario, fertilization begins when a forward-moving, motile sperm is deposited in the upper part of the vagina during normal sexual intercourse. From there, the sperm travel through the reproductive tract, guided by natural mechanisms, to reach the fallopian tubes. Within the tubes, the fimbriae of the fallopian tube play a key role. They pick up the ovum from the ovary and transport it toward the site where fertilization occurs. When the sperm meets the ovum, fertilization takes place, forming a zygote. This fertilized egg then travels to implant in a healthy endometrial lining of the uterus. The process of ovulation, where a healthy ovum is released from the ovary, is vital for this entire sequence to occur. All of these steps, ovulation, fertilization, transport, and implantation, are orchestrated by a superb physiological process. When everything functions properly within both partners, pregnancy occurs naturally and efficiently. It's truly a remarkable, finely tuned biological process that underscores the importance of both partners' health and function. Let's take a closer look at this diagrammatical representation of work in the female reproductive system. As you can see here, the diagram highlights the key components involved in this complex process. It helps us visualize how each part interacts and contributes to functions like ovulation, fertilization, and pregnancy. Notice the placement of the ovaries, which are responsible for releasing eggs, and the fallopian tubes, where fertilization typically occurs. The uterus is shown as the site for embryo implantation and development. Understanding this diagram is crucial because it illustrates the integrated nature of these structures and functions. It reminds us how finely tuned and coordinated the female reproductive system is, and how each part plays a vital role in reproductive health and fertility. This visual representation ties into our overall theme of understanding reproductive biology, emphasizing the importance of each component working together seamlessly. Let's take a closer look at this diagram, which provides a visual representation of how work is organized within the female reproductive system. As you can see, this diagram highlights the key structures involved in reproductive functions. The main components include the ovaries, fallopian tubes, uterus, and vagina. These parts work together in a coordinated manner to facilitate processes like ovulation, fertilization, and pregnancy. For instance, the ovaries produce eggs and hormones like estrogen and progesterone, which regulate the menstrual cycle. The fallopian tubes serve as the pathway for the eggs to travel from the ovaries to the uterus, and they are also the site where fertilization typically occurs. The uterus is where a fertilized egg implants and develops into a fetus, while the vagina acts as the canal for childbirth and menstrual flow. This diagram helps us understand the complexity and the elegance of the reproductive system. It underscores how each part has a specific role, but also works in harmony with others to support reproductive health and function. Recognizing these connections is essential as we explore how this system impacts overall health, fertility, and hormonal balance. The female reproductive system's activity is regulated by hormones that are released both by the brain and the ovaries. These hormones work together to create what we call the reproductive or menstrual cycle. Typically, this cycle lasts between 24 and 35 days. During this time, an egg, or ovum, develops and matures. At the same time, the lining of the uterus prepares itself to receive a fertilized egg. If fertilization doesn't occur, the lining is shed through bleeding, which we know as a period or menstruation. The first day of this bleeding is considered day 1 of the cycle. A key event in this cycle is ovulation, which is when a mature egg is released from one of the ovaries. This usually happens around the 14th day in a typical 28-day cycle. Now, let's talk about the hormones controlling this process. There are 5 main hormones involved. 3 are produced in the brain, and 2 are made in the ovaries. The first is gonadotrophin-releasing hormone, or GnRH, made by the hypothalamus in the brain. GnRH signals the anterior pituitary to release FSH and LH, which are crucial for the cycle. FSH, or follicle-stimulating hormone, travels to the ovaries and stimulates immature eggs to start growing. LH, or luteinizing hormone, also reaches the ovaries, triggers ovulation, and encourages the formation of a structure called the corpus luteum. Now, regarding the ovaries, they are the sex steroid-producing gonads in females. They produce estrogen, which is made by the growing eggs and the corpus luteum. Estrogen plays a vital role in regulating the levels of GnRH, FSH, and LH, helping prevent too many eggs from developing at once. It also supports the development and maintenance of female reproductive structures. Estradiol and estrone are released by ovarian follicles and the corpus luteum, while estriol is a metabolic product of estrone. The other important hormone is progesterone, mainly produced by the corpus luteum. It works with estrogen to thicken the uterine lining in preparation for a potential pregnancy and also prepares the breasts for milk production. High levels of progesterone help regulate the levels of GnRH, FSH, and LH, maintaining the cycle's balance. So, in summary, the female reproductive system works through this intricate hormonal interplay to regulate the cycle, ensuring that ovulation happens at the right time and the uterus is prepared for pregnancy or resets if pregnancy doesn't occur. Yoga is considered as old as civilization on Earth. It's truly remarkable to think that this spiritual science of self-realization has been passed down through generations, across different cultures, from one century to another. Most often, it's been shared orally, through word of mouth, but there are also texts that have preserved its teachings. Interestingly, there's no specific date we can point to as the origin of yoga. It's more of a timeless tradition that has evolved over millennia. Since the dawn of mankind, both scientists and philosophers have been deeply curious about 2 fundamental questions. The first is the quest for reality, understanding what is true and what is real. The second is the quest for happiness, seeking peace, contentment, and fulfillment in life. These questions have driven humanity to explore different theories and develop various practices, and yoga is one of the most profound among them. In a way, the evolution of yoga reflects our ongoing search for meaning and well-being. It's a path that connects us to our inner selves, helping us navigate the deeper questions of existence. And as we explore its roots and development, we see how it fits perfectly into the broader theme of seeking truth and happiness in our lives. The reproductive system works and depends on a complex interplay of different organs and hormones. It's designed to perform specific functions like producing eggs and sperm, supporting fertilization, and nurturing a developing fetus. These processes are highly coordinated, and the system relies on this delicate balance to function properly. If any part of this system is disrupted, it can affect fertility and reproductive health. Throughout this presentation, we've seen how vital these functions are not just for individual health, but for the continuity of the human species. So, understanding how the reproductive system works and what it depends on helps us appreciate the importance of maintaining overall health and hormonal balance. Yoga has a remarkable ability to control the autonomous nervous system by establishing a balance between the sympathetic and parasympathetic nervous systems. This balance is achieved through the hypothalamic limbic system, which acts as a key regulator. When we practice yoga, we're essentially working to harmonize these two branches of the nervous system, which are responsible for our stress responses and relaxation responses. By doing so, yoga helps us gain control over our mind first. Once the mind is calm and focused, this control naturally extends to the body, creating a seamless connection between mental and physical well-being. Since the entire autonomic system governs vital functions, like heart rate, digestion, and respiration, regulating it through yoga can have profound effects on our overall health. Now, let's talk about the scientific effects of yoga on our vital organs and systems. When we practice regularly, yoga influences the nervous system in ways that can improve the functioning of these organs. For example, it can help lower blood pressure, enhance digestion, and even improve respiratory efficiency. Essentially, yoga acts as a bridge, positively impacting our body's vital functions by modulating the nervous system. This interconnected relationship underscores the importance of yoga not just as a physical practice, but as a holistic approach to health, where mind and body work together in harmony to promote overall well-being. Let's talk about the role of yoga in infertility and how it can truly make a difference. Yoga helps to increase fertility by focusing on specific practices like yogasana, pranayama, meditation, bandha, mudra, and shakriya, which are tailored for both men and women trying to conceive. These practices are designed to strengthen the reproductive organs and the pelvic area. By increasing blood flow and stimulating energy in these regions, yoga can actually enhance the chances of pregnancy. Another important aspect is how yoga helps couples deal with emotional and psychological stress. Infertility often brings about a lot of trauma and stress, which can negatively impact fertility. Through pranayama and meditation, we can cultivate a calm and peaceful mental state. This not only reduces emotional stress, but also helps to balance hormones and improve the functioning of reproductive organs. A quiet, stable mind and body are believed to create a more fertile environment, making conception more likely. Many couples who practice yoga report feeling stronger, more confident, and more in tune with their bodies. Yoga encourages a positive connection with oneself, which is crucial during the fertility journey. Additionally, yoga promotes a nutritious, balanced diet and healthy lifestyle choices. Once people adopt regular yoga practice, they're often motivated to make better dietary and lifestyle decisions, which further supports fertility. When combined, these elements create a holistic approach that can significantly improve the chances of conception for infertile couples. So, in essence, yoga isn't just about physical postures. It's about creating a balanced, healthy mind and body, key ingredients for enhancing fertility and supporting the overall reproductive health. Healthy and balanced diet has a significant effect on fertility. Fresh organic fruits and vegetables are rich in vitamins and minerals that are essential for overall health, especially for the reproductive organs. When people consume fewer of these foods, it can lead to nutrient deficiencies, which may disrupt the normal process of conception. Anti-inflammatory foods like garlic, ginger, and pepper are also very beneficial. They contain high amounts of antioxidants, which help boost our immune function by fighting against abnormal cell growth. Plus, they help prevent inflammation in the pelvic region, which is important for maintaining reproductive health. Fruits and vegetables also improve blood flow to the reproductive organs. They make the blood thinner, which enhances the transportation of nutrients and oxygen to body cells, including those in the reproductive system. This improved blood flow can reduce the risk of low-quality sperm in men and poor-quality eggs in women, supporting fertility. Additionally, certain fresh organic fruit, vegetable juices, and soups help increase fat and protein metabolism. This, in turn, supports the health of nerve cells, improving how they transmit information between each other and the glands. This process can lower the risk of nerve-related issues like fatigue, stress, depression, and anxiety, all of which can impact fertility. So overall, a healthy, balanced diet rich in these foods not only benefits general health, but also directly supports reproductive health and improves the chances of conception. When it comes to lifestyle for infertility, it's really important to manage stress and avoid things that can negatively impact your body and mind. Patients should try to steer clear of tension, anxiety, and strenuous exercise, as these can interfere with fertility. Also, late nights and spending long hours watching television can be detrimental, so establishing a balanced routine is key. On the other hand, light yoga postures, meditation, and breathing exercises are actually recommended, as they help promote relaxation and improve overall well-being. Diet plays a crucial role too. It's best to avoid heavily processed foods like packaged and canned items, spicy foods, gas-causing vegetables, sweets, and excessive amounts of tea and coffee. These can disrupt your body's balance and hinder conception. Importantly, alcohol and smoking should be completely stopped because they significantly reduce your chances of conceiving and can damage your overall health. Instead, focus on eating lots of raw and organic foods. Think fresh fruits and vegetables, whole grains, and dairy products like milk and lassi. Dry fruits such as almonds are also beneficial. These foods help detoxify your body and create a healthy environment for conception to occur. When couples incorporate yoga, nutritious diet, and a healthy lifestyle, they not only reduce stress but also boost their overall health. This holistic approach can really make a difference in improving fertility rates. Remember, it's about creating a balanced, healthy environment for both your mind and body to support conception. Let's talk about the benefits of yoga when it comes to infertility, starting with the mental benefits. As many of you know, facing an infertility diagnosis can bring a significant amount of stress. This stress affects not just physically, but also mentally, emotionally, socially, financially, and even educationally. So it's natural to wonder, why not try natural fertility treatments early on before jumping into more medical interventions? Yoga can play a very helpful role here. It's not just about physical postures, it also supports mental health. Practicing yoga helps calm the nervous system, especially through breathing techniques that lower stress hormones like cortisol. This reduction in stress hormones is beneficial for fertility and can even improve sleep quality at night. Beyond that, yoga encourages maintaining a positive attitude, reducing anxiety, and minimizing mental fatigue. It helps find a balance within the mind and body, which is crucial during this challenging time. It also promotes hormonal balance, which is vital for conception. Many people also experience relief from insomnia and an uplifted mood through regular yoga practice. When you're less stressed and more balanced mentally and physically, it creates a more conducive environment for fertility. So, incorporating yoga into your routine can be a natural, holistic way to support your journey toward conception. Let's talk about the physical benefits of yoga for reproductive health. First, yoga helps increase strength and tones the muscles that support the reproductive organs, which is essential for their proper function. It also improves the overall alignment of your body, promoting better posture and balance. Additionally, yoga aids in excreting toxins from the body, which can positively impact reproductive health. One of the key benefits is that yoga increases blood flow to the reproductive organs. By removing blockages in the lower waist area, such as around the tubes, ovaries, and uterus, yoga enhances circulation. This allows vital nutrients and oxygen to reach these organs more effectively, supporting their health and function. Yoga also helps regulate proper breathing patterns. When we breathe correctly, it enhances oxygen intake, which benefits both the mind and body. This increased energy and stamina, especially in the related organs, can have a profound impact on overall reproductive wellness. Now, let's focus on ovarian function. Specific yogasanas, pranayamas, and meditation techniques boost blood circulation to the pelvic area and near the ovaries. For example, poses like legs up the wall, along with breathing exercises like anulom, Vilum and practices such as Yog Nidra and Dhyana increase blood flow to reproductive organs. This improved circulation enhances oxygen capacity, helps balance hormones, and delivers more nutrients, all of which support ovarian health. Finally, yoga can positively influence IVF success rates. It helps increase conception chances by controlling hormone imbalances, reducing stress, and enhancing blood oxygen flow to various organs and systems. Additionally, practicing yoga boosts confidence in couples undergoing IVF, which is a vital psychological benefit during this challenging journey. In summary, yoga offers a comprehensive set of physical benefits that support reproductive health, improve function, and can even enhance fertility outcomes. When an infertility couple practices yogasanas regularly, we begin to see noticeable changes in their physiology, helping to restore balance where it's needed most. The most important physiological effects are on the endocrine system, which regulates hormones and works through the HPO axis to maintain reproductive health. Then there's the nervous system. Yoga helps shift the body from a sympathetic state, which is our stress response, to a parasympathetic state, our relaxation mode. This balance is essential for the reproductive system to function optimally. Additionally, yoga strengthens the immune system. Practices like pranayama and meditation reduce stress, which positively impacts immunity. Breathing techniques, when done rhythmically, create a deep sense of connection to our own healing capacity, enhancing overall well-being. Now let's talk about how yoga can lessen side effects of hormonal treatments. During infertility treatments, stress is a common challenge which can disrupt recovery. But incorporating yogasanas, pranayamas, yog nidra, and meditation, such as sarvangasana, padmasana, anulom vilom, kapalbhati, bhastrika, and brahmari pranayamas, can significantly reduce stress responses. When stress hormone levels decrease, the body recovers more quickly and returns to a balanced state of mind and body. Achieving a parasympathetic state allows the reproductive system to work more effectively and safely, leading to better and more sustainable results. Let's talk about the health benefits of yoga for men, especially regarding infertility issues. Men today are also facing challenges like low sperm count, which includes conditions such as azoospermia and oligospermia. These problems often stem from lifestyle choices, eating habits, or deficiencies and weaknesses in the body. When these issues go unaddressed, they can lead to increased stress levels. Now, chronic stress releases cortisol into the bloodstream, which can negatively impact sperm motility, leading to lower fertility. The good news is, practicing yoga during this time can help. It reduces stress effectively and can help increase or regain sexual stamina. So, yoga isn't just about physical flexibility. It plays a vital role in supporting reproductive health by managing stress and boosting overall vitality. Today, I want to talk about the health benefits of yoga for women, especially those facing fertility challenges. Many women who are infertile are not fully aware of how yoga can actually help increase their chances of conception and even lead to a live birth. In our society, women often endure a lot of stress and emotional turmoil due to infertility, facing pressure from family and society at large. This stress can really take a toll on their mental and physical health. But here's the encouraging part. When infertile women adopt a regular yoga practice, it helps release that stress and restore a sense of calmness. It's not just about relaxation. Yoga also helps rebuild self-confidence and boosts stamina, both physically and mentally. For women experiencing menstrual irregularities, anovulation, or issues like overweight, tubal blockage, leukorrhea, or PID, yoga can bring about significant improvements. Not only do these health issues often improve, but the chances of conception tend to increase after consistent practice. So, yoga is more than just physical exercise. It's a holistic approach that supports women's reproductive health, reduces stress, and enhances overall well-being. This aligns perfectly with our goal of promoting natural health solutions to improve fertility. Yoga can be a powerful tool to help improve your relationship with your partner. When couples practice yoga together, It can enhance their communication skills, both verbally and nonverbally. Studies have shown that practicing yoga as a team fosters better understanding and connection. Yoga also teaches calmness and relaxation, which are essential for emotional balance. When both partners focus on their inner selves and find moments of peace, it creates a more harmonious environment. This shared sense of tranquility encourages spending quality time together, strengthening your bond. Importantly, reducing emotional stress through yoga can positively impact intimate moments. When stress is lowered, couples often show more passion and energy, which can be beneficial for their overall fertility. So, integrating yoga into your routine isn't just about physical health. It's about nurturing a deeper, more connected relationship that supports your journey together. Let's explore the relationship between yoga and married life. Historically, all yoga practices were designed by yogis to help achieve higher spiritual goals. In those times, sexual restraint was seen as crucial for spiritual development, so yoga was often considered mainly for saints who led celibate lives. However, today we understand that yoga is much more versatile. It can be practiced to improve health and treat various disorders. Scientifically, it has been proven that yoga does not diminish sexual potential. In fact, it revitalizes physical health. Since yogic practices enhance sexual vitality, there's really no reason for married people to hesitate in practicing yoga. Now, let's talk about yoga and sex. The desire for sexual activity primarily originates in the mind. Yoga, by taking care of the mind and streamlining the nervous system, can help manage this urge effectively. Regular practice can even help remove weaknesses related to sexual behavior. A key point here is discipline. A lethargic attitude can break both mental and physical discipline, which is essential for sexual efficiency. Yoga helps bring vitality and dynamism, driving away lethargy and boosting sexual potential. Yoga also incorporates psychosomatic techniques, which focus on the physical, mental, and emotional aspects of human beings. Through practices like pranayama, these aspects are enhanced. While sex involves physical intimacy, it also deeply involves mental and emotional connections between partners. Practicing yoga improves neuromuscular function, which contributes to better sexual health. Additionally, yoga promotes positive qualities such as tolerance, forgiveness, and concern for others, qualities that are fundamental for a happy married life. So, in essence, yoga is not only compatible with married life, but can actually enrich it by improving health, emotional balance, and mutual understanding. Today, I will discuss the statement of the problem for our study. The core focus is on understanding the effects of lifestyle, diet, and yoga therapy in cases of infertility. Essentially, we want to see how these factors influence fertility outcomes and whether they can serve as effective interventions. The study was planned to span over 3 years, starting from February 16, 2013, and concluding on March 31, 2016. This duration allowed us to observe changes over a substantial period and gather meaningful data. Regarding the methodology, although I won't go into every detail here, I can tell you that our approach was comprehensive. We incorporated various techniques to assess how lifestyle modifications, dietary habits, and yoga practices impact infertility. This integration is crucial because it ties into the overall theme of exploring holistic and non-invasive ways to improve reproductive health. By examining these aspects thoroughly, our goal was to contribute valuable insights into alternative therapies that could benefit many individuals facing infertility challenges. Today, I will talk about the area of the research, which is Delhi. The profile of the selected hospital is quite specific. The cases for the study were taken from the outpatient department, or OPD, of the Stri and Prasudi Tantra department at Tibia Ayurveda and Unani Hospital and College, located in Karol Bagh. This hospital is run by the government of Delhi. The OPD hours were from 9:00 in the morning to 2:00 in the afternoon. During this time, patients received consultation, counseling, and yoga therapy specifically for infertility, all under the supervision of gynecologist Dr. Deepa Misra. In addition to these cases, nearly 200 patients were screened across 3 other hospitals in Delhi. These hospitals include Lady Harding Medical College and Hospital at Shivji Stadium, Safdarjung Hospital, and Chandra Hospital in Shastri Nagar. These patients also received counseling and yoga therapy through their respective OPDs, which are operated by both government and private authorities. However, it's important to note that these 200 patients were not included in the actual research study. The reason is that our study design focused on analyzing the effects of yoga therapy on a specific group of 80 patients. Out of these, 120 patients had already been selected from the OPD of the Stri and Prasudi, Tantra department at Tibia Ayurveda and Unani Hospital. The patients who were chosen for the study were interested in undergoing yoga intervention and had given written consent, which is a requirement for ethical research. So, in summary, while we screened a larger number of patients across multiple hospitals, our actual research was conducted on a well-defined group of 80 patients, ensuring that the study results are precise and ethically sound. Let's take a closer look at the selection process for our study. We started with a total of 120 infertility patients, chosen randomly to ensure unbiased results. These patients were assessed based on various factors such as their socioeconomic background, lifestyle habits, and their anatomical, physiological, and psychological status. Once evaluated, they were divided into 2 groups according to their own interests. The first group, those interested in yogic intervention alone, consisted of 80 patients. The second group, those who preferred to take Ayurveda medicine along with yogic intervention, included 40 patients. This division allowed us to compare the effects of different therapeutic approaches on infertility outcomes. Now moving on to the results after the therapy period. For the group interested in yogic intervention, we observed several outcomes. Some patients became fertile, some were cured without becoming fertile, others experienced partial relief, and unfortunately, a few showed no response at all. We categorized these outcomes into 4 groups: fertile, cured without fertility, partially relieved, and no response. Similarly, for the group taking Ayurveda medicine along with yogic intervention, but not regularly, we tracked their outcomes in the same way. This setup helps us understand the effectiveness of these interventions individually and together. Lastly, the research study design is summarized in a flow chart, which visually represents the process from patient selection through intervention and evaluation. This flow chart is a key part of understanding how the study was structured, ensuring transparency and clarity in our methodology. Let's look at the samples we used for this study. We selected a total of 120 diagnosed patients of infertility from the outpatient department of Stri and Prasudi, in the Tantra department of Tibia, Ayurveda, and Unani Hospital College, located in Karol Bagh, Delhi. Regarding our sampling technique, these 120 patients were chosen randomly from the outpatient department. This ensured that our sample was representative of the population visiting these clinics. The patients came from various hospitals in Delhi, including Lady Harding Medical College and Hospital at Shivji Stadium, Connaught Place, Safdarjung Hospital, and Chandra Hospital in Shastri Nagar. For the grouping, we divided the patients into 2 main groups. The first was Group I, the experimental group, consisting of 80 patients who were willing to actively practice regular yogasanas, pranayamas, and meditation, what we refer to as our yogic intervention. The second was Group II, also an experimental group, made up of 40 patients. These patients were initially convinced to practice the same yogic interventions along with Ayurveda medicines. However, over time, they were less consistent with their yogic practice. Now, moving on to the material and methods, specifically the collection of normative data. This step is crucial because it helps us establish baseline information before the intervention. Gathering normative data allows us to understand the initial status of each patient, which is essential to measure the effectiveness of our interventions accurately. In summary, this process of careful sampling, grouping, and collecting normative data forms the foundation of our study, helping us ensure that our results are reliable and meaningful within the overall context of exploring holistic approaches to infertility treatment. So, keeping in view the objectives of our study, we've designed a set of tools to help us gather comprehensive data. First, there is the informed consent form, which ensures that participants are fully aware and agreeable to take part in the study. Then, we have the patient information sheet, which provides essential details about each participant's background. For capturing general and clinical information, we used the Health Profile I, which was filled out for all 120 participants. This helps us get a complete picture of their health status. To analyze the data more specifically, especially for the infertile participants, we created the Health Profile II. This tool aids in the statistical analysis by dividing participants into groups based on their causes of infertility and their yoga therapy adherence, whether they are regular or irregular in practicing yoga. We also developed the yogic intervention profile to document the specific yoga practices followed by each participant. Additionally, a diet chart was provided to promote a nutritious diet that supports overall health, which is an important part of the intervention. There's also a checklist designed for personal use, which helps participants track their progress and adherence to the prescribed routines. All these tools were carefully developed under the guidance of our supervisor, and some of them were presented to our guide to serve as records of the process. Overall, the tools and their design were tailored specifically for this study to ensure we collect accurate, relevant data that aligns with our research goals. Now, let's look at the inclusion criteria for our study. Starting with females, we consider women who have been married for at least a year, and during that time, the couple has stayed together without conceiving. If a woman has had one delivery and hasn't conceived in the last 2 to 3 years, she qualifies for inclusion. Additionally, women with a history of repeated abortions are included, as are those with tubal blockage or fibroid uterus. These are key reproductive issues we're aiming to study. Turning to males, semen analysis is performed in certain cases, specifically when the male partner accompanies the woman. We also advise yogic therapy and compare results before and after to assess any improvements. Now, moving on to the exclusion criteria. We exclude anyone below 20 or above 35 years of age to focus on the reproductive age group. Patients with certain health conditions are also excluded, including tuberculosis, diabetes, coronary heart disease, asthma, liver or kidney disorders, and HIV/AIDS. We also exclude women with degree uterine prolapse, severe thyroid disorders, ovarian cysts larger than 2 inches, or any structural abnormalities in the genital organs. These criteria help us select the appropriate participants for our study, ensuring that we focus on the factors most relevant to reproductive health and the effects of our interventions. Now, let's take a closer look at the parameters we use for assessment. Starting with the subjective parameters, these are the factors that the patient reports or describes. For example, irregular menstruation is a common issue that can impact fertility, so we pay close attention to any irregularities in the menstrual cycle. Then there's dysmenorrhea, which refers to painful periods, and stress, which can also influence reproductive health. Moving on to the objective parameters, these are measurable or observable factors that we evaluate during examinations or tests. Tubal blockage is a significant concern because it can prevent conception, so assessing tubal patency is crucial. Ovulation status helps us determine if the patient is releasing eggs regularly, which is essential for fertility. We also consider specific cases like PCOS or polycystic ovary syndrome, which is a common cause of infertility and involves hormonal imbalance and ovarian cysts. Additionally, BMI, or body mass index, gives us insight into the patient's weight relative to height, as both underweight and overweight conditions can affect fertility. Semen analysis is important too, as it evaluates male partner fertility potential. Altogether, these parameters, both subjective and objective, help us build a comprehensive picture of the patient's reproductive health, guiding us towards the most effective management plan. Connecting these points to our overall goal, understanding these factors allows us to identify underlying issues and tailor our approach for better outcomes. Let's talk about the short diagnosis process, which is based on a detailed health profile. This includes taking a thorough history and conducting a clinical examination. Additionally, various diagnostic tests are performed, such as ultrasound scans, HSG, follicular studies, and semen analysis reports. Blood and urine tests may also be done if necessary or advised for further investigation. When we look at the results, we can identify patients who are diagnosed as infertile, which means they have difficulty conceiving. We also see cases with irregular menstrual cycles, which can impact fertility. Tubal blockage is another critical factor we examine, as it can prevent eggs from reaching the uterus. Follicular disorders are also assessed, as they can interfere with ovulation. Understanding these diagnosis and test procedures helps us identify the underlying causes of infertility and related conditions. This comprehensive approach ensures we can tailor the right treatment plan for each patient, ultimately supporting their journey toward conception. After completing the inclusion and exclusion criteria, patients were interviewed to assess any improvements in both subjective and objective parameters before and after practicing yogasanas and pranayamas. Only then was the assessment of infertility and menstrual irregularity carried out, tailored to each individual case. The protocol for investigations, along with the results of the yoga intervention, were considered carefully throughout the study. During the treatment period, patients underwent investigations at specific intervals. At baseline, 45 days, 90 days, 120 days, 180 days, 270 days, and 360 days. These assessments were performed before and after the intervention at each point, based on what was necessary for each infertile patient, as recommended by the senior consultant. For follow-up, the patients continued practicing yogasanas and pranayamas regularly. They practiced 6 days a week for 6 months, maintaining consistency to maximize benefits. The infertile women, during menstruation, performed specific poses like titalyasana, relaxation techniques, and walking with normal breathing to support their condition. Practices were paused when women conceived, but if fertile participants, including pregnant women, wanted to continue yoga, they were advised on gentle breathing techniques and easy asanas suitable for pregnancy. After 6 months, infertile patients were asked to perform yoga at home and visit us every 10 days or sooner if needed for special conditions, to consult with the senior specialist and researcher. Follow-up assessments were conducted within days during the therapy period and again after 6 months. These follow-ups helped us evaluate improvements and determine if the patients had achieved fertility. The criteria for follow-up and testing focused on measuring progress and confirming whether the intervention led to successful fertility outcomes. Now, moving on to the statistical techniques we used in our analysis. First, we systematically organized the collected data using tables and graphs. This step was crucial to ensure everything was clearly arranged and ready for further statistical treatment. We plan to analyze the data primarily through descriptive statistics and percentages, which help us summarize and understand the key trends. The detailed analysis and interpretation will be presented in the upcoming chapter, providing deeper insights into the data. Regarding the analysis itself, we focused on both parametric and non-parametric statistics. These are important because they allow us to handle different types of data depending on their distribution and characteristics. However, for the scope of this study, we mainly relied on group difference analysis and percentage change calculations. These methods help us identify how groups differ from each other and quantify the extent of change over time or between conditions. In summary, our approach combines organized data presentation with robust statistical techniques, ensuring that our findings are both accurate and meaningful. This foundation sets the stage for a thorough interpretation of the results, linking back to the overall objectives of our research. Let's delve into the major findings related to the general conditional dependency dimensions, which primarily include socioeconomic status factors. Starting with age, we see that the largest group is those between 30 and 35 years old, accounting for about 35.84%, followed closely by the 25 to 30 age group at 33.33%, and those under 25 at 30.83%. This indicates a fairly balanced distribution across these age ranges. Moving on to education, there's a significant disparity. About 95% of individuals are illiterate, whereas only 25% are literate. This highlights the critical educational gap that might influence health awareness and access to resources. When we consider family income, most families fall within the 5,000 to 10,000 or 10,000 to 15,000 range, comprising roughly 32.5% and 30.83%, respectively. Fewer families have higher incomes, which could impact their ability to seek advanced healthcare services. Looking at infertility types, the majority, around 83%, are classified as type I, with the remaining 19.17% as type II. Additionally, when examining unexplained infertility, an overwhelming 87.5% fall into this category, compared to 12.5% with explained causes. This suggests that many cases lack clear etiology, complicating treatment approaches. Switching to lifestyle conditional dimensions, the data shows that a staggering 91.67% of individuals do not engage in regular exercise, which could influence overall reproductive health. Nutritional diets are mostly average or poor. 47% have an average diet, and 52.5% consume poor diets, highlighting nutritional deficiencies that might impact fertility. Substance use is also noteworthy. About 11.67% consume alcohol, 10% smoke cigarettes, and 19.17% use tobacco regularly. Junk food consumption is high at 50%, while only about 9.16% report abstaining from recreational substances altogether. These lifestyle choices could have significant effects on reproductive health. Environmental conditions reveal that over half, around 57.5%, live in unhygienic environments, which can contribute to health issues, while 42.5% have hygienic surroundings. Regarding diet and sleep routines, only about 20.83% have timely diets, and 25% maintain regular sleep patterns, emphasizing areas for potential improvement. Now, let's look at anatomical, physiological, and psychological dimensions. Dysmenorrhea affects approximately 35% of the population, while tubal blockage is seen in about 10.83%. Ovulation issues are present in 13.33% and PCOS in 27.5%. BMI data shows that 46.66% are within a healthy weight range, but a significant 39.16% are overweight, and 14.16% are obese. Irregular menstruation impacts 30%, and semen analysis reveals abnormalities in about 39.66%. Unexplained infertility remains at 12.5%, consistent with earlier findings. Psychologically, a large majority, around 17%, experience stress or psychological distress, which can have profound effects on fertility. Finally, these findings connect to the overarching objective of understanding the causes of infertility in both females and males, emphasizing how these multifaceted factors, biological, lifestyle, environmental, and psychological, interplay and influence reproductive health. As we look at this table and the accompanying bar diagram, it's quite clear that out of a total of 120 infertility patients, a significant majority, specifically 80 patients, were recruited into experimental group I, which involved yogic interventions. Meanwhile, 40 patients opted for experimental group II, which combined Ayurveda medicines along with yogic interventions. If we break down the percentages, about 2/3, or 66.7%, of the patients chose yogic interventions alone, whereas roughly 1/3, or 33.3%, preferred the combined approach with Ayurveda. This distribution honestly reflects the interest levels among the patients, and it's important to note that their choices were influenced by their own preferences and comfort levels. Connecting this to the overall theme of our presentation, it highlights how different treatment options appeal to different individuals, and understanding these preferences is crucial as we evaluate the effectiveness of these interventions in improving fertility outcomes. Now, let's take a closer look at the general conditional dependency dimensions, specifically focusing on socioeconomic status. This concept essentially highlights how socioeconomic factors can influence various outcomes, behaviors, or conditions. It's important to understand that these dependencies aren't fixed. They can vary depending on different contexts and conditions. When we talk about socioeconomic status, we're referring to aspects like income, education, and occupation, which can all shape a person's opportunities and experiences. Recognizing these dimensions helps us see how changes in socioeconomic factors might condition or modify other variables we're studying. This understanding is key to developing more nuanced and effective interventions or policies, especially when aiming for equitable outcomes across diverse populations. It ties back to our overall theme of understanding complex dependencies and the importance of considering multiple factors in our analysis. As we can see from Table 2 and the accompanying bar diagram, a total of 120 patients were evaluated for infertility. Among them, 15 patients, which accounts for about 12.5%, were suffering from unexplained infertility. On the other hand, the remaining 105 patients, making up 87.5%, were diagnosed with explained infertility. This data clearly shows that unexplained infertility is relatively less common compared to explained infertility in this group. It's an important point because it highlights that most cases we encounter tend to have identifiable causes, which can often be targeted with specific treatments. Understanding this distribution helps us appreciate the relative prevalence and guides us in focusing our diagnostic efforts. It also underscores the importance of thorough evaluation, as a significant majority of infertility cases have explanations that can potentially be addressed. So overall, this slide emphasizes that while unexplained infertility does exist, it constitutes a smaller portion of the cases we see, and most patients have identifiable factors contributing to their infertility. Looking at Table 3 and the bar diagram, we can see some interesting patterns among these 120 infertility patients. Out of all these patients, 97 are suffering from infertility type I degrees, which accounts for about 80.83%. The remaining 23 patients, or roughly 19.17%, are dealing with infertility type 2 degrees. What this tells us is that the number of patients with type 2 degrees infertility is comparatively lower. Often, these patients already have some issue affecting their fertility, and they are now trying for their next chance at conception. On the other hand, a larger proportion of patients with type I degrees infertility are those who, after marriage, initially had no apparent issue, but are now facing difficulties in conceiving. This distribution is quite telling. It indicates that most patients are in the earlier stage of infertility, where no apparent problem has been identified yet, and they are actively seeking solutions. It also highlights the importance of early intervention and understanding the different types of infertility as part of our overall approach to treatment and counseling. In the table and the bar diagram shown above, we can see the age distribution of infertility patients. The data clearly indicates that the highest number of patients are in the age group of 30 to 35 years, followed by the 25 to 30 age group. Interestingly, the smallest group consists of patients below 25 years. To give you exact numbers, there are 37 patients under 25, which makes up about 30.83% of the total. The 25 to 30 age group has 40 patients, accounting for roughly 33.33%. And the largest group, the 30 to 35 years, includes 43 patients, or about 35.84%. Overall, this distribution suggests that the peak age for seeking infertility treatment is in the 30 to 35-year range. This information is important because it helps us understand at what age most patients are experiencing infertility issues, which can guide us in developing targeted interventions and support strategies. As we see, the majority of patients tend to seek help around their early to mid-30s, which aligns with broader trends in reproductive health. Let's take a closer look at the distribution of married life among our infertility patients. As you can see, the table summarizes the duration of marriage at the time of diagnosis or treatment. Starting with the shorter durations, only 2.5% of patients, which is 3 individuals, have been married for just 18 months. Moving to around 2 years, we see 5% of patients, or 6 individuals. The number increases significantly as we look at the 3-year mark, with 17.5%, or 21 patients. Interestingly, there are no patients listed at 4 years of marriage, which could suggest a shorter time span before seeking treatment or perhaps some data limitations. The most prominent group falls around the 5-year mark, where 22.5% of patients, totaling 27 individuals, have been married for about 5 years. This indicates that many couples seek infertility evaluation or treatment after about this period of trying to conceive. Beyond that, the distribution varies. 13.33% of patients, or 16 individuals, have been married for 6 years, while 15.82%, or 19 patients, are at 7 years. The numbers then decline slightly, with 5% at 8 years and just a small percentage at 9 and 10 years, each accounting for about 1.67%. Interestingly, there are no patients recorded at 11 years of marriage, but at 12 years, we see 7.5%, which is 9 individuals. The percentages tend to taper off as the duration increases, with a few patients at 13, 14, 15, and 20 years. Overall, this distribution helps us understand the marriage duration at the time of presentation, which can influence our approach to treatment and counseling. It also shows that most couples tend to seek infertility help within the first 5 to 6 years of marriage, but some continue trying for many more years before seeking intervention. Understanding these patterns is crucial because it reflects both the social and biological factors that impact when couples seek help, and it ties into the broader theme of how marriage duration influences infertility management. In this slide, we're looking at the distribution of married life among infertility patients, as shown in the table and the pie diagram. What stands out here is that a significant number of these patients seek treatment during their married years. The pie chart visually emphasizes this, showing how many individuals come for treatment at different stages of their married life. This information is crucial because it helps us understand at what point couples are most likely to seek help, which can inform how we approach education, outreach, and treatment options. Overall, it highlights the importance of timely intervention and support throughout a couple's married years, tying into the broader theme of improving fertility care and understanding patient behavior. In this slide, we see the data summarized in both the table and the bar diagram. As you can see, a significant majority of the infertility patients, about 95%, are illiterate, with 79 out of 120 patients falling into this category. In contrast, only 21 patients, or 25%, are literate. This clearly indicates that illiterate patients form the larger group among those seeking infertility treatment. What's particularly important here is the implication of this disparity. It suggests that illiterate patients might face more challenges when it comes to understanding and discussing infertility issues. They might also be less comfortable or less familiar with navigating healthcare systems, which can make consultation more difficult for them. Connecting this to our overall theme, it highlights the crucial need for tailored communication strategies when working with different educational backgrounds. Ensuring that all patients, regardless of literacy level, receive adequate support and information is essential for improving their treatment experience and outcomes. This table and bar diagram clearly illustrate the distribution of patients based on their family income. As we can see, the majority of patients, specifically 39 individuals, come from families earning between 5,000 and 10,000 rupees per month. Close behind, 37 patients belong to the 10,000 to 15,000 rupees income bracket. Fewer patients, around 26, fall into the 15,000 to 20,000 range. Interestingly, only 2 patients have a family income between 20,000 and 25,000 rupees, and equal numbers, 8 patients each, are in the 25,000 to 30,000 and 30,000 to 35,000 brackets. From this, we can see that the highest number of infertile patients are from families with lower income levels, specifically less than 15,000 rupees per month. This highlights an important point. It appears that lower-income families are more affected or perhaps more likely to seek treatment at this stage. Additionally, the overall family income significantly impacts infertility. Higher expenditures on treatments and investigations can be challenging for lower-income families, which may influence their ability to pursue or continue treatment. So, understanding this income distribution helps us grasp the socioeconomic factors that are intertwined with infertility issues. It's a crucial aspect to consider when designing accessible and affordable treatment options for all income groups. Let's look at hypothesis 1, which suggests that an unhealthy lifestyle and diet can lead to infertility. Now, this isn't just a random assumption. There's a growing body of evidence supporting this idea. When we talk about lifestyle conditional dimensions, we're referring to various factors like diet, physical activity, stress levels, and habits such as smoking or alcohol consumption. All of these elements can significantly influence reproductive health. For example, poor nutrition can affect hormone levels and ovulatory function, while lack of exercise or excessive stress can disrupt the delicate balance necessary for conception. Connecting this to the overall theme, it highlights how our daily choices and habits play a crucial role in fertility. So, understanding these lifestyle factors is key to addressing and potentially improving infertility issues. In the table and the bar diagram on this slide, we can see some interesting patterns among infertility patients and their dietary habits. Specifically, 57 patients were following an average diet, while 63 were eating a poor diet. Notably, no one was consuming a rich diet. This indicates that the majority of patients, about 52.5%, are eating a poor diet, and nearly half, 47.5%, are eating an average diet. It's quite clear that the most common dietary pattern among these patients is the poor diet, which could potentially impact their fertility. The absence of patients eating a rich diet suggests that healthier, nutrient-rich eating habits might be less prevalent in this group. Overall, this data highlights the significant role diet quality plays in infertility, emphasizing the need to focus on improving nutritional habits as part of lifestyle interventions. It's a clear reminder that what we eat can have profound effects on reproductive health. In the table and the bar diagram shown here, we can see that a significant number of infertile patients, specifically 69, are living in hygienic environments. Meanwhile, 51 patients are living in unhygienic conditions. If we look at the percentages, about 57.5% of these patients are in hygienic environments, whereas 42.5% are in unhygienic environments. This data suggests that environmental conditions could play a notable role in infertility. It highlights that maintaining a hygienic environment might be an important factor for improving reproductive health. Ultimately, this indicates that patients may need to address their environmental conditions as part of their overall approach to overcoming infertility. So, improving hygiene could be a key step in their journey toward better reproductive outcomes. This connection between environment and health is an important piece of the overall picture we're exploring in this presentation. In this slide, we see a table and a bar diagram that highlight the usage of recreational substances among infertile patients. As we analyze the data, it's clear that alcohol was taken by 14 patients, which accounts for about 11.67% of the total. Smoking was slightly less common, with 12 patients, or 10%. Interestingly, no patients reported using drugs. Tobacco, on the other hand, was used by 23 patients, making up around 19.17%. Junk food was the most prevalent, with 60 patients, which is a significant 50% of the group. Lastly, only 11 patients, or about 9.16%, were not taking any recreational substances at all. This distribution tells us that the majority of infertile patients were engaged in some form of recreational substance use, with junk food being the most common. It's quite telling because it suggests that these habits could be a major contributing factor to infertility. The key takeaway here is that reducing or eliminating recreational substance consumption could potentially improve fertility outcomes. Looking at the table, it's evident that habits like junk food consumption and tobacco use are the most widespread among these patients. This aligns with the overall theme of the presentation, which emphasizes lifestyle modifications as a crucial step in addressing infertility. The data clearly shows that these substances are prevalent and possibly impactful, reinforcing the importance of lifestyle changes for improving reproductive health. In this slide, we see a table and a bar diagram illustrating the data from 120 infertility patients. What stands out immediately is that only 25 of these patients, which is about 20.83%, are maintaining a timely diet. Similarly, only 30 patients, or 25%, are getting enough sleep on time. When we look at the total, just around 45.83%, or 55 patients, are practicing both timely diet and sleep. This means that a significant majority of these patients are not following these healthy habits consistently. As we know, both diet and sleep play crucial roles in reproductive health. The fact that most patients are not adhering to these basic practices suggests that poor lifestyle choices could be a major contributing factor to infertility. So, the key takeaway here is that maintaining a timely diet and sleep schedule could be vital in addressing infertility issues. It really highlights the importance of lifestyle modifications as part of a holistic approach to fertility treatment. This data underscores that in our overall theme, lifestyle factors are major determinants of fertility outcomes. Let's delve into hypothesis 1, which suggests that anatomical and physiological deficiencies, along with psychological conditions, are more responsible factors for infertility. When we look at these dimensions, anatomical, physiological, and psychological, they each play a crucial role in reproductive health. In our analysis, we consider both subjective and objective parameters. These are divided into two parts: pre-treatment assessments and post-treatment outcomes. The pre-treatment data help us understand the initial status, while the post-treatment results, which include tables, graphs, and pie charts, show us the effects of interventions and the progress made. By thoroughly examining these factors and their outcomes, we aim to identify the most significant contributors to infertility, emphasizing how interconnected and complex these dimensions are. This approach allows us to see clearly where targeted strategies can make the most difference, ultimately aligning with our overall goal of improving fertility outcomes. Let's take a closer look at this table. It shows that out of 120 patients, 42 were suffering from dysmenorrhea, which accounts for about 35% of the group. Now, if we refer to the pie diagram and the previous data, it becomes clear that dysmenorrhea is actually the major cause of infertility among these patients. Specifically, these 42 patients with dysmenorrhea stand out as a significant portion, highlighting its impact on fertility issues. So, understanding and addressing dysmenorrhea could be key in managing infertility effectively. This emphasizes the importance of screening for menstrual pain and related symptoms as part of a comprehensive fertility assessment. Here, we see the data on infertility patients specifically related to tubal blockage. Out of the total 120 patients, 13 are affected by this condition. That's approximately 10.83%. If you look at the table and the accompanying pie diagram, it clearly shows that tubal blockage is a significant contributor to infertility in this group. This means that roughly 1 in 10 of these patients suffer from this particular issue. Recognizing tubal blockage as a major cause helps us understand where to focus our diagnostic efforts and treatment options. Overall, this highlights the importance of screening for tubal issues when evaluating infertility. Addressing these blockages can make a meaningful difference in helping many women conceive. So, understanding this data reinforces the broader theme that identifying specific causes like tubal blockage is crucial in improving infertility management. Looking at this table and the accompanying pie diagram, we can see that out of the 120 infertile patients, 16 of them were suffering from ovulation issues. This means that ovulation problems account for a significant portion of infertility cases in this group. Specifically, If we look at the percentage, it's about 13.33%. Now, what's really important here is that ovulation appears to be the major cause of infertility among these patients. This underscores the critical role that proper ovulation plays in fertility. Recognizing this helps us focus on targeted treatments that address ovulation issues, which could potentially improve outcomes for many of these patients. So, within the overall context of infertility causes, ovulation problems stand out as a key factor we need to pay attention to. As we look at this table, it clearly illustrates that out of the 120 patients we studied, 33 of them were suffering from PCOS. Now, if you look at the pie diagram, you'll see that these 33 patients represent about 27.5% of the total. This is a significant proportion, and it highlights an important point. Polycystic ovary syndrome, or PCOS, appears to be the major underlying cause of infertility in this group. This connection is crucial because it guides us toward targeted interventions and treatments. Recognizing PCOS as a leading factor helps prioritize diagnosis and management strategies, ultimately aiming to improve fertility outcomes. So, in summary, the data underscores that PCOS isn't just a common condition. It's a predominant contributor to infertility among these patients. Looking at the table and the pie chart together, we can see some important trends. Out of the 120 patients, none were underweight, which is interesting. The majority, 56 patients, are within the healthy weight range, which accounts for about 46.66%. Overweight patients number 47, making up nearly 39.16%, and obese patients are 17, representing about 14.16%. What really stands out here is that both overweight and underweight categories are either minimal or non-existent. But the significant takeaway is that overweight and underweight are major factors linked to infertility, as measured by BMI. This data clearly shows that deviations from a healthy weight, particularly being overweight, are strongly associated with infertility issues. It highlights the importance of maintaining a healthy BMI, especially in the context of fertility health. Ultimately, managing weight could be a key step in improving fertility outcomes. As we look at this table and the accompanying pie diagram, it becomes clear that out of the 120 patients we studied, 36 of them, which is about 30%, were suffering from irregular menstruation. This is a significant proportion, and it highlights an important point. Irregular menstruation appears to be the major cause of infertility among these patients. What this tells us is that when evaluating infertility, paying close attention to menstrual regularity is crucial. The data really emphasizes that irregular cycles are not just a menstrual concern, but also a key factor in infertility issues. Connecting this to the overall theme of our presentation, it underscores the importance of identifying and managing menstrual irregularities early on, as they can have a direct impact on a woman's fertility. This insight can guide both diagnosis and treatment approaches moving forward. In this slide, we see that the table and the pie diagram together highlight an important point. Out of the 120 patients who underwent semen analysis, 47 were identified as infertile due to low and inactive sperm. This accounts for approximately 39.66% of the total patients. What this clearly shows is that low and inactive sperm is the leading cause of male infertility in this group. It's a significant finding because it emphasizes the impact of sperm quality on fertility. By understanding these numbers, we can better appreciate the importance of focusing on sperm health when diagnosing and treating male infertility. This also helps guide us in tailoring more effective interventions for patients facing these challenges. As we look at this table and the accompanying pie diagram, you'll notice that out of the 120 infertile patients, 15 of them are suffering from unexplained infertility. That represents about 12.5% of the total. What this really highlights is that unexplained infertility is a significant contributor, almost a major cause, of infertility cases in this group. It's important because it shows that despite our medical advances, there's still a substantial number of cases where the exact cause can't be identified, which makes diagnosis and treatment more challenging. This underscores the need for further research and more comprehensive diagnostic approaches to better understand these unexplained cases and improve patient outcomes. Now, moving on to the fourth objective of the thesis, which focuses on the psychological impact of infertility. This aspect is crucial because infertility doesn't just affect the physical ability to conceive. It also has profound emotional and mental effects. It can lead to feelings of frustration, sadness, or even depression, which significantly impact an individual's overall well-being. Understanding this psychological dimension helps us see the broader picture, how infertility influences people's lives beyond the biological challenges. It emphasizes the importance of providing emotional support and mental health resources as part of infertility treatment and support systems. By exploring this, we can better appreciate the depth of the experience for those going through it and how addressing psychological impacts can improve their overall quality of life. This objective ties back to our overall theme of holistic care and understanding in the field of reproductive health. Looking at the table and the pie diagram, we can see some striking data. Out of 120 infertility patients, a significant 95 of them, which is about 79.17%, were suffering from a psychological condition, specifically stress. This clearly indicates that stress and psychological factors play a major role in infertility for both men and women. It's important to note how these mental health aspects, such as stress, can impact reproductive health and contribute to infertility issues. This finding emphasizes the need to consider psychological well-being as a crucial part of infertility treatment and management, aligning with the overall theme that holistic approaches are essential in addressing infertility challenges. Now, moving on to the fifth objective of my thesis. The main goal here is to explore how yoga therapy can help reduce or even minimize the causes of infertility. Essentially, I want to see if this approach can create a happier, more harmonious path for couples facing these challenges. In terms of my hypothesis, I believe that yogic therapy combined with psychological counseling might be a significant step forward. It could potentially help in minimizing the complications related to fertility. What's really important to understand here is how these holistic approaches, mind and body working together, can influence fertility outcomes. This ties back to the overall theme of my research, which is about integrating traditional and modern therapies to improve reproductive health and overall well-being for couples. Let's now look at some of the major findings from our study on yogic interventions and their impact on infertility. First, we observed that practicing yoga can significantly help with dysmenorrhea, which is often linked to infertility issues. By reducing menstrual pain and discomfort, yoga appears to improve overall reproductive health. Next, we found positive effects on tubal blockage, a common cause of infertility. Regular yogic practice seems to help in maintaining the patency of the fallopian tubes, increasing the chances of conception. When it comes to ovulation and PCOS, yogic interventions showed promising results. Many women experienced more regular ovulation cycles, which is crucial for fertility, especially in PCOS cases. This highlights yoga's role in balancing hormonal functions. We also looked at BMI, and the findings were quite encouraging. For patients who were underweight or overweight, yoga helped in achieving a healthier body weight, another vital factor for fertility. Maintaining an optimal BMI can improve reproductive outcomes significantly. Regarding irregular menstruation, which often leads to fertility challenges, yoga was effective in regulating menstrual cycles, thereby improving the chances of conception. Consistent practice can bring about hormonal balance and cycle regularity. In men, we observed an increase in active sperm counts among those practicing yoga. This suggests that yoga can boost male fertility by improving sperm quality, which is an essential component of successful conception. Additionally, yoga had a positive impact on the psychological well-being of those facing infertility. Reducing stress and anxiety through yoga can enhance overall reproductive health, as mental health plays a crucial role in fertility. Finally, for cases of unexplained infertility, where no clear cause is identified, yogic interventions still showed benefits. They seem to support the body's natural ability to achieve conception, possibly by improving hormonal balance and reducing stress. Overall, these findings reinforce the idea that yoga is a holistic approach that can address multiple facets of infertility, from physical to psychological. It's a valuable complementary tool in our fertility management strategies. In this slide, we see a detailed table showing the results of various causes of infertility, comparing those who benefited from the treatment versus those who did not, across two experimental groups. In experimental group I, which consisted of 80 patients following a regular yogic intervention, we see that all patients with dysmenorrhea, tubal blockage, ovulation issues, and PCOS benefited completely, meaning 100% benefit in these categories. Similarly, for irregular menstruation, all 31 patients benefited, which is significant. When we look at semen analysis, all patients benefited there as well, indicating the positive impact of the intervention on male fertility factors. In contrast, for psychological stress, although 67.5% benefited, there were still some who did not, highlighting that mental health is a complex factor. Moving to experimental group II, which involved 40 patients with irregular cycles, the benefits are slightly varied. For example, dysmenorrhea benefits were lower, with only about 37.5% benefiting. Tubal blockage showed a similar trend, with roughly a third benefiting. Interestingly, ovulation issues in this group showed a complete benefit, with all 4 patients improving. For PCOS, the benefit was around 60%, and for irregular menstruation, about 20%. It's important to note that the BMI data shows a mix of normal and overweight patients, with some benefits observed across these categories. Psychological conditions showed about half benefiting, and for unexplained infertility, only 20% benefited, which might suggest these cases are more challenging to address. Overall, this table underscores that the yogic interventions had a substantial positive impact across many causes of infertility, although the degree of benefit varied depending on the specific condition. Understanding these results helps us appreciate how holistic approaches can improve fertility outcomes in different patient groups. In the table above, we see that there are 2 experimental groups involved in this study. The first group consists of 80 patients who regularly participated in yogic intervention, while the second group includes 40 patients who relied solely on Ayurveda medicines without regular yogic practice during the research period. Now, looking at the outcomes, we observe that both groups had patients suffering from various causes of infertility, and some of these patients benefited from the treatments while others did not. Focusing first on the group that practiced yogic intervention regularly, experimental group I, we see that their results are quite promising across different causes. For example, in cases of dysmenorrhea, all 34 patients benefited. Similarly, for tubal blockage, all 4 patients saw benefits, and the same applies to ovulation with 12 patients benefiting. In cases of PCOS, 28 out of 28 patients experienced benefits, and for irregular menstruation, all 31 patients benefited. When it comes to BMI, 45 patients with high BMI benefited, as did 45 with overweight and 12 with obesity, again, all benefiting. Semen analysis results were equally positive, with all 43 patients benefiting. Psychological stress also showed significant improvement, with 68 out of 68 patients benefiting. Even patients with unexplained infertility showed some benefits, with 1 out of 5 patients improving. Now turning to the second group, those who didn't participate regularly in yogic intervention but relied on Ayurveda medicines, the results are less consistent. For dysmenorrhea, 8 patients were treated, but only 3 benefited. Tubal blockage saw 9 patients treated, with 3 benefiting. For ovulation, 4 patients were involved, but none experienced benefits. PCOS had 5 patients, with 2 benefiting. Similarly, for irregular menstruation, 5 patients were treated, but only 1 benefited. In BMI cases, out of 11 high BMI patients, 6 benefited, but the overweight and obese categories had fewer benefits or none at all. Semen analysis showed some improvement, with 2 out of 4 patients benefiting. Psychological stress improved in 14 out of 27 patients, but for unexplained infertility, none of the 10 patients benefited. Overall, what we see clearly is that the group practicing yogic interventions regularly had a significantly higher rate of benefits across most causes of infertility, compared to the group relying solely on Ayurveda medicines. This comparison highlights the potential effectiveness of consistent yogic practice in addressing various infertility parameters, which fits into our overall theme of exploring integrative approaches for better reproductive health. Let's take a closer look at the data from experimental group I, which consisted of patients undergoing a regular yogic intervention. In this group, we had a total of 80 patients out of the initial 120 infertility cases. The table categorizes the outcomes into 4 main responses: those who were cured and now are fertile, those who are cured without becoming fertile, those who experienced partial relief, and those who showed no response. For the males and females combined, 12 patients, which is about 15% of this group, became fully fertile, meaning their fertility was restored. Then, 40 patients, or roughly 50%, were cured but did not regain fertility. Next, 15 patients, or approximately 18.75%, experienced partial relief, indicating some improvement but not complete resolution. Lastly, 13 patients, making up around 16.25%, showed no response to the treatment. Overall, the most significant point is that 65% of these patients experienced some positive outcome, either full fertility or partial relief, highlighting the potential effectiveness of yogic intervention in managing infertility. The scoring system used here assigns points based on the outcome: a score of 3 for fertility, 2 for cured without fertility, 1 for partial relief, and 0 for no response. This helps us quantify the results and compare the effectiveness of the intervention systematically. Connecting this to our overall theme, these findings reinforce the idea that integrative approaches, like yoga, can play a meaningful role in improving reproductive health outcomes. Looking at the table and the bar diagram here, we see that in the experimental group I, a total of 80 patients were regularly following the yogic intervention. Now, among these, the research showed that there were 12 fertile males and 40 females, which means, overall, 52 individuals benefited from the intervention in terms of fertility. Out of these, 39 were explained cases, and only 1 was unexplained. Moving further, the study also categorized outcomes beyond just fertility. For instance, 15 patients were cured without fertility, meaning their issues were resolved completely. Additionally, 9 patients experienced partial relief, and unfortunately, 4 showed no response to the intervention at all. What this all suggests is quite compelling. Yogic intervention appears to have a positive impact on overcoming the causes of infertility. It not only helps improve fertility rates, but also contributes to overall reproductive health naturally. This fits well into our overall message that holistic approaches like yoga can be effective in addressing complex health issues. In this slide, we're looking at the data for experimental group II, which involved Ayurveda medicines combined with irregular yogic intervention. Out of the total 120 patients, 40 were assigned to this group. The scoring system we used ranged from 3 to 0, where 3 indicates fertility in both male and female partners, 2 means they were cured but without fertility, 1 shows partial relief, and 0 reflects no response. Now, focusing on the results within this group, we see that 9 couples, about 5%, achieved fertility. 6 couples, or roughly 15%, were cured but without fertility. Another 6 couples, again 15%, experienced only partial relief. And unfortunately, there were 11 couples, making up 27.5%, who showed no response at all. Looking at the detailed table, we see that among the 40 patients, 9 were fertile males and 6 were fertile females. 6 were cured without fertility, 8 showed partial relief, and 11 had no response. Overall, these findings are quite significant because they demonstrate that, while a notable proportion of patients responded positively, either becoming fertile or being cured, there's still a portion that did not respond. This highlights the potential of Ayurveda plus yogic intervention, but also the need for further refinement to improve outcomes across all patients. Connecting this to our broader presentation, it underscores the importance of integrative approaches in addressing complex health issues like infertility, showing promising results, but also areas for ongoing improvement. In this table and the accompanying bar diagram, we see some interesting findings about experimental group II. In this group, 40 patients were taking Ayurveda medicines, but they were not following a regular yogic intervention alongside. The researcher noted that among these patients, 9 were fertile males and 6 were females, making a total of 15 patients who were fertile. When we look at the outcomes, 6 patients were cured without fertility, 8 experienced partial relief, and unfortunately, 11 showed no response at all. What this tells us is that Ayurveda medicines, when used irregularly without consistent yoga practice, did not produce very satisfactory results. In comparison, the yogic intervention group, which I assume was more regular and disciplined, showed better outcomes overall. This highlights the importance of consistency and combined approaches in treatment, reinforcing the idea that integrating yoga regularly can significantly impact the effectiveness of therapies. It's an important point in understanding how different interventions work, especially in the context of holistic health. In conclusion, I want to emphasize that yoga therapy proves to be a very effective tool and remedy for treating infertility. Our findings show that yogic intervention has successfully helped patients with both type I and type II infertility, often saving them from the need for costly and invasive treatments and investigations. We also observed that timing plays a crucial role. Patients who seek help at the proper age and the right time tend to benefit the most from yoga. This highlights the importance of early intervention. Another significant point is the impact of literacy. The study revealed that illiterate patients tend to suffer more, mainly because of a lack of awareness or ignorance. Sadly, many of them end up wasting valuable time, age, and money on treatments that may not be suitable or effective. Illiteracy also diverts their focus away from their primary goal of overcoming infertility and can lead to increased physical, emotional, and social stress. We found that most of these patients come from low-income groups. Due to financial constraints, they are unable to afford expensive treatments and investigations, which adds to their stress when doctors prescribe costly medications and procedures. This financial burden often worsens their emotional well-being. Furthermore, diet and lifestyle play a vital role. Many patients were not eating at proper times, which contributed to delayed or negative results. That's why, in the yogic intervention group, we recommended maintaining a timely diet and sleep schedule. This approach helped improve hormonal balance, neuromuscular activity, and overall reproductive health, leading to faster and more effective results. Overall, this study reinforces that yoga, when combined with proper lifestyle adjustments, can be a powerful, accessible, and holistic approach to overcoming infertility challenges. In our study, we found that the highest number of infertility patients were consuming poor diets, which actually worsens the complications related to infertility. Many of these patients preferred junk, oily, and spicy foods, relying heavily on medicinal treatments to address their issues. Interestingly, the group that was given a rich and nutritious diet along with yogic intervention showed a significant improvement in recovery rates compared to those who didn't follow this approach. We also observed that most of these patients were not engaging in any form of physical exercise or workout. When they adopted yogic intervention, they gained more confidence and patience, which contributed to faster and more favorable results in their infertility treatment. Additionally, we saw that treating patients under hygienic conditions was much more effective and faster than in unhygienic environments. This highlights how important a clean, healthy setting is for recovery. Another crucial point is the impact of recreational substances. Many patients were consuming alcohol, smoking, tobacco, or junk food, which created obstacles in their treatment process. However, when patients in the yogic intervention group followed protocols to relinquish these substances, they experienced an increase in confidence and patience, and their mental and physical balance improved. This, in turn, led to better treatment outcomes. We also included patients with gynecological issues such as irregular menstruation, stress, dysmenorrhea, tubal blockage, ovulation problems, PCOS, increased BMI, and unexplained infertility, as well as male factors like oligospermia. The results showed that yogic intervention, combined with a healthy lifestyle, was highly effective. In fact, many patients experienced noticeable improvements within just 3 to 6 months, leading to increased fecundity. Overall, these findings emphasize how lifestyle modifications, proper diet, hygienic conditions, and yogic intervention collectively can significantly enhance fertility outcomes in a relatively short period. In this slide, we see some interesting findings from our study regarding fertility rates in different groups. In experimental group I, which involved yoga intervention, 65% of the patients were found to be fertile. In contrast, in experimental group II, where patients relied more heavily on medication, only 37.5% were fertile. This clearly indicates that the group practicing yoga and adopting a healthier lifestyle had a higher fertility rate compared to the group dependent on medicines. Additionally, we observed that experimental group II was too reliant on medications. As a result, patients in this group experienced more side effects and complications during their treatment process. On the other hand, in group I, where patients followed yogic practices, along with nutritious diet, healthy lifestyle, and psychological counseling, there was a significant reduction in infertility complications. These patients were able to achieve fertility more naturally and sustainably. This comparison underscores the importance of holistic approaches like yoga and lifestyle modifications in managing infertility, rather than just dependence on medication. It aligns with our overall message that a balanced, integrated approach can lead to better health outcomes and fertility success. Let's delve into some key points about yoga and its role in infertility, based on research insights. First, the yoga system involves static, low-dynamic activities that significantly impact the neurohormonal axis. This is fundamental because it helps regulate hormonal balance, which is crucial in fertility. Next, during breathing techniques, there is an enhanced flow of blood throughout the body, especially through the lungs. When we inhale deeply, more oxygen enters the bloodstream, and more carbon dioxide is exhaled. Both of these processes are beneficial for overall health, maintaining a healthy rhythm and supporting bodily functions. The importance of yoga here lies in its physical training effect on the nervous system. It's not just about flexibility or strength, but about controlling and purifying the nervous system, which in turn influences muscular movements and strength. Furthermore, yoga can help regulate endocrine glands by controlling blood supply to specific areas. This regulation is vital because hormones are essential in fertility, and balancing them can support reproductive health. Another interesting point is that certain yogic postures increase intercapillary pressure, which boosts lymph flow. Enhanced lymph circulation improves tissue tone and promotes regeneration, supporting overall bodily resilience. Finally, the deep, rhythmic breathing practiced during asanas supplies a rich supply of oxygen-rich blood to muscles, internal organs, and endocrine glands. This continuous oxygenation supports their optimal functioning, which is fundamental in creating a healthy environment for conception. So overall, yoga's multifaceted effects on hormonal balance, circulation, nervous system control, and tissue health highlight its potential as a supportive practice in addressing infertility. Yoga strengthens the immune system by incorporating practices like pranayama, or breath control, and meditation. These tools are particularly effective in reducing stress, which in turn produces positive changes in our immune response. When we manage stress better, our body becomes more resilient and healthier overall. Now, let's look at the hypothesis that has been proved. Unhealthy lifestyle and diet are major factors leading to infertility. Even if someone is physically fit and consumes a proper diet, it can help. But if the lifestyle is irregular and unhealthy, simply eating nutritious food won't make a significant difference. It's also important to understand that anatomical and physiological deficiencies, along with psychological conditions, play a more responsible role in infertility. These factors need to be addressed carefully. That's where yogic therapy and psychological counseling come into play. They can be significant steps toward minimizing fertility complications, helping the body and mind work together more harmoniously. Now, what about stress? If I'm stressed, or if someone else is under stress, what can it do? Honestly, stress itself isn't the enemy, it's how we respond to it. We have a choice: either let stress control us or take charge of our well-being. And the key is clear. We can choose yoga and psychological counseling as effective tools to manage stress and improve our overall health. So remember, it's about making the conscious decision to prioritize these practices for a healthier, more balanced life. Now, moving on to the third objective of our thesis, which focuses on yogic therapy in different types of infertility cases, specifically for the age group of less than 25 to less than 35 years. Here, we're looking at how yogic practices can be tailored to address infertility challenges within this young to middle adult demographic. The treatment pattern we applied involved a structured yogic therapy protocol, which was consistently followed. This included a specific profile of yogic interventions designed for infertility periods. Typically, each session was conducted on a regular schedule, lasting about 60 minutes. These sessions combined various yogic techniques aimed at improving reproductive health, balancing hormonal functions, and reducing stress, factors that are often linked to infertility issues. The key point here is that this systematic approach allows us to evaluate how effective yogic therapy can be as a complementary treatment, especially when customized for different types of infertility cases within this age group. Ultimately, this objective ties back to our broader goal of exploring holistic, non-invasive methods to support fertility. And the structured, consistent application of these practices is central to achieving meaningful results. Let's take a closer look at the yogic intervention profile during the infertility period, focusing on a regular 60-minute session schedule. The strength of pranayamas lies in practicing them consistently, with a minimum of 2 to 3 minutes per session, and up to 5 minutes for each type, depending on individual capacity. Rest periods are flexible and should be guided by factors like age, nature, weather, and stamina. Initially, we start with yogic breathing, which is a combination of 3 types of breathing techniques. This can be practiced either lying down or sitting comfortably. The 3 are abdominal breathing, thoracic breathing, and clavicular breathing. We recommend a preparatory practice of this combined breathing for the first 7 days to help the body and mind adapt. After the initial week, we move on to Nadi Shodhana Pranayama, which is practiced for about 15 days. This alternate nostril breathing helps balance the nervous system and prepares us for more advanced techniques. Following that, after 15 days, we introduce Ujjayi Pranayama, often called the psychic breath, which is known for calming the mind and increasing oxygen intake. It's a powerful practice that enhances focus and inner stability. Next, we incorporate Bhastrika Pranayama, also known as the bellows breath. This energizing technique boosts vitality and clears mental clutter. Again, this is introduced after 15 days of practice. Kapalbhati Pranayama, which is focused on frontal brain cleansing, is also introduced after the same 15-day period. It helps energize the mind and detoxify the frontal regions of the brain. Finally, we practice Bhramari Pranayama, or humming bee breath. This is especially calming and helps reduce stress, making it a valuable tool for emotional balance during this period. Throughout this process, the key is gradual progression, listening to your body, and ensuring each practice is tailored to your individual needs. These techniques, when practiced consistently, can support both physical and mental well-being, ultimately contributing positively to fertility. Let's talk about yogasanas today. When practicing these postures, it's important to tailor the repetitions based on various factors like your age, nature, weather conditions, stamina, or overall capacity. This personalized approach helps ensure safety and effectiveness. First, we have Titali Asana, also known as the Ardha and Purna butterfly. This posture is excellent for opening the hips and stimulating the abdominal organs. It mimics the gentle fluttering of a butterfly, promoting flexibility and calmness. Next is Surya Namaskar, or salutations to the sun. This sequence involves 12 steps and serves as a complete physical warm-up, energizing the body and preparing it for deeper practice. It also connects us with the sun's vital energy. Moving on to Shakti Bandha asanas, or energy block postures. These include Rajjukarshanasana, which is like pulling a rope, helping to stretch and strengthen the back and shoulders. Then there's Kashtha Takshanasana, or chopping wood, which invigorates the entire body. The Namaskarasana, or salutation pose, fosters humility and reverence, while Vajrasana helps improve digestion and stability. We also have the Marjariyasana, the cat stretch pose. Think of it as a gentle spine massage, promoting flexibility and relieving tension. Followed by Manjukasana, the frog pose, which opens the hips and stretches the inner thighs. Ustrasana, or the camel pose, can be practiced in halves or fully. It's fantastic for opening the chest and strengthening the back. Lastly, Supta Vajrasana, or sleeping thunderbolt pose, is a relaxing position that helps soothe the nervous system and improve digestion. Remember, repeating these yogasanas 1-3 rounds, adjusted for your individual factors, can greatly enhance your flexibility, strength, and overall well-being, aligning perfectly with our goal of holistic health. Now, let's explore some of the key asanas that focus on different body functions and benefits. Starting with backward bending asanas, we have Matsyasana, also known as the fish pose. This pose helps open the chest and stretch the throat, promoting better breathing and relieving tension. Next is Shalabhasana, which includes both half and full locust poses. These are excellent for strengthening the back muscles and improving posture. Kantarasana, or shoulder pose, is another vital backward bend that enhances shoulder flexibility and opens the chest area. Moving on to inverted asanas, Nakasana, or boat pose, is fantastic for core strength and balance. It engages the abdominal muscles while also promoting stability in the spine. For balancing asanas, Ardha Matsyendrasana, the half-spinal twist, is very effective. It helps improve spinal flexibility and aids digestion. Paschimottanasana, the back stretching pose, stretches the entire back body, calming the nervous system and relieving stress. Another important pose is Parivritti Janu Sirsasana, or the spiraled head to knee pose. This asana enhances spinal flexibility and stretches the hamstrings, promoting overall flexibility. Lastly, Viparita Karani Asana, often called the legs up the wall pose, is an inverted pose that promotes relaxation, improves circulation, and relieves tired legs. All these asanas are integral to a balanced practice, as they target different muscle groups and functions, supporting our overall theme of holistic well-being through yoga. Now let's talk about relaxation asana, which is especially useful when the patient wants to unwind during yogic practice. Typically, this can last from about 30 seconds to a minute, or longer if needed, depending on the individual's requirement. We often start with Shavasana, also known as corpse pose, which helps in deep relaxation and integration of the practice. It's a moment to let go and simply be present. Next, we have Matsya Kritasana, or the flapping fish pose. This gentle movement can help release tension, improve circulation, and promote a sense of calm. It's a simple yet effective way to relax the body. Moving on to pranayama postures, which are sitting postures used during breathing exercises. These are essential for maintaining proper posture and stability during pranayama. The first is Sukhasana, or easy pose. It's a comfortable cross-legged sitting position that allows for relaxed breathing and concentration. Then we have Ardha Padmasana, or half lotus pose. This position offers more stability and helps deepen the meditative state, especially for those comfortable with sitting cross-legged. Finally, Padmasana, the full lotus, which is a more advanced seated posture. It promotes stability, alertness, and a steady mind during pranayama. All these postures are interconnected, forming the foundation for calming the mind and preparing the body for deeper practice. The key is to choose the posture that feels most comfortable and sustainable for each individual, ensuring a safe and effective relaxation experience. Let's take a closer look at Ardha Tatali Asana, or the half butterfly pose, and compare it with the full butterfly pose, known as Purna Tatali Asana. These poses are wonderful for opening up the hips and relaxing the lower body. In Ardha Tatali, we focus on a gentle stretch, keeping one foot planted while the other leg is bent, bringing the sole of the foot close to the inner thigh. It's a great way to ease into hip flexibility and prepare the body for deeper stretches. Now, when we move into Purna Tatali Asana, the full butterfly pose, it involves both feet pressing together, with knees gently dropping towards the ground, resembling the wings of a butterfly. This pose deepens the stretch, enhances circulation, and promotes flexibility. Understanding the progression from half to full butterfly helps us see how we can gradually increase intensity without overstraining. These poses tie into our overall theme of mindful movement and body awareness, emphasizing gradual development and listening to our bodies. Remember, consistency and gentle progression are key to gaining the full benefits of these stretches. Now, let's move on to some important yoga poses that can really enhance our overall well-being. First, we have Surya Namaskar, or salutations to the sun. This sequence is a powerful full-body practice that not only stretches and strengthens various muscle groups, but also energizes the body and calms the mind. It's often called a moving meditation because of its rhythmic flow and deep connection to breath. Incorporating Surya Namaskar into your daily routine can boost flexibility, improve circulation, and promote a sense of mental clarity. Next, we look at Nakasana, also known as the boat pose. This pose primarily targets the core muscles, helping to strengthen the abdomen and improve balance. It's a fantastic way to build core stability, which is essential for overall posture and daily activities. When practicing Nakasana, focus on maintaining a steady breath and engaging your core muscles, and you'll notice how it also helps with concentration and mental focus. Both of these poses exemplify how yoga integrates physical health with mental well-being, aligning perfectly with our overall theme of holistic health. They are accessible yet effective practices that can fit into any fitness routine, offering multiple benefits in just a few minutes a day. Let's explore some powerful asanas that help us develop strength and focus. First, we have Rajjukarshanasana, which is like pulling a rope. This pose engages the arms, shoulders, and core, helping to build stamina and concentration. It's a dynamic movement that reminds us of the importance of pulling ourselves forward with determination. Next, we move to Kashtatakshanasana, or chopping wood pose. This posture emphasizes rhythmic, repetitive motion, strengthening the back and arms. It's like mimicking the action of chopping wood, which not only tones the muscles, but also cultivates patience and rhythm in our practice. Then there's Namaskarasana, the salutation pose. This is a foundational posture that promotes humility and respect. It's a simple gesture, but it carries a lot of significance, reminding us to approach our practice and life with reverence and gratitude. Finally, we come to Shakti Bandha asanas, or energy block postures. These poses are designed to activate and balance our internal energy centers. They help us release blockages, enhance vitality, and prepare the body and mind for deeper states of awareness. All these poses, when integrated into our routine, serve the broader goal of strengthening our physical body while harmonizing our energy. They embody the principle that physical strength and energetic balance go hand in hand on the path of yoga. Now let's take a look at Marjariyasana, also known as the cat stretch pose. This pose is a fundamental part of many yoga routines because it helps to gently stretch and mobilize the spine. When practicing this pose, you start on your hands and knees, aligning your wrists under your shoulders and your knees under your hips. As you inhale, you lift your tailbone and chin, arching your back kind of like a cat stretching. Then, as you exhale, you round your back towards the ceiling, tucking your chin toward your chest. This movement is not just about flexibility, it's also about connecting breath with movement, which enhances mindfulness and body awareness. The cat stretch is especially useful for relieving tension in the back and neck, areas that often carry stress from daily activities. In the context of our overall practice, this pose emphasizes the importance of spinal health and gentle mobility. It's a perfect example of how mindful, controlled movements can support both physical well-being and mental clarity. Remember, the key is to move smoothly and breathe consciously, making this a calming and restorative exercise. Now, let's move on to some important poses that enhance flexibility and strength in the back and hips. First, we have Ustrasana, the camel pose, which is excellent for opening the front of the body and stretching the spine. Next is Ardha Ustrasana, the half camel pose, a modified version that offers similar benefits with less intensity, making it accessible for everyone. Finally, we have Manjukasana, the frog pose, which deeply opens the hips and stretches the thighs. These poses are key components of a balanced practice, helping us improve posture, increase flexibility, and cultivate a sense of openness. They also connect to the overall theme of strengthening and releasing tension in the body. Let's take a look at some variations of Matsyasana, the fish pose, to deepen our practice. First, we have Matsyasana itself, which is excellent for opening the chest and stretching the front of the body. It promotes better posture and helps alleviate tension in the shoulders and neck. Then, there's Supta Vajrasana, also known as the sleeping thunderbolt pose, which offers a gentle backbend and a calming effect on the nervous system. Both poses emphasize the importance of opening the heart and cultivating a sense of ease in the body. These variations highlight how we can modify foundational poses to target different areas and enhance our overall flexibility and strength. Remember, integrating these variations can help us connect more deeply with our breath and our intention behind each pose, aligning with the broader theme of mindful movement and inner awareness. Today, we're exploring Shalabhasana, or the half-locust pose, specifically the Ardha Salabhasana, which is the second variation. This pose is fantastic for strengthening the back, improving posture, and enhancing core stability. When practicing this variation, focus on engaging your back muscles gently but firmly while keeping your neck relaxed and in line with your spine. It's important to lift your legs and chest simultaneously, maintaining balance and control. Remember, the key is to avoid overextending or straining, so listen to your body. Incorporating this pose into your routine can help build resilience in your back muscles, which supports overall spinal health. As with all poses, consistency and mindful breathing are essential to reap the full benefits and ensure safe practice. Today, I want to highlight two important yoga poses that deepen our practice and enhance flexibility. First is Ardha Matsyendrasana, or the half spinal twist. This pose is fantastic for improving spinal mobility and stimulating digestion. It encourages a gentle twist that releases tension in the back and shoulders, promoting better posture and spinal health. Next, we have Kandharasana, commonly known as the shoulder pose. This pose helps open up the shoulders and chest, increasing flexibility and strength in these areas. It's particularly beneficial for counteracting the effects of a sedentary lifestyle and poor posture. Both of these poses connect to our overall goal of cultivating a balanced, flexible body and mind. They remind us that through mindful movement and breath, we can improve our physical health and inner awareness. Incorporating these into our routine supports the broader theme of holistic well-being. Now let's look at two important forward bends. First, we have Parivriti Janu Sirsasana, which is a spiraled head-to-knee pose. This pose emphasizes twisting and stretching simultaneously, helping to improve spinal flexibility and stimulate digestion. The spiral movement encourages a deep twist, which not only stretches the back and hamstrings, but also enhances spinal mobility and detoxification. Next, we move to Paschimottanasana, the classic seated forward bend. This pose is primarily about stretching the back, hamstrings, and calves. It helps calm the nervous system, improve flexibility, and promote a sense of relaxation. When practiced mindfully, it can also aid in relieving stress and tension accumulated in the back and shoulders. Both of these poses are vital for balancing the spine and enhancing overall flexibility, which ties into our broader goal of cultivating strength and suppleness in the body. Remember, the key is to approach each pose with awareness and gentle effort, always respecting your body's limits. Today, I want to introduce you to Viparita Karani Asana, also known as the inverted pose with legs up against the wall. This pose is quite powerful for calming the nervous system and relieving stress. When we practice this asana, we're essentially in an inverted position, which helps improve circulation and promotes relaxation. It's a great way to counteract fatigue and refresh your mind. The key here is to be gentle and mindful of your body's limits, especially if you have neck or back issues. Connecting this to our overall theme, Viparita Karani Asana reminds us of the importance of inversion for mental clarity and physical balance. It's a simple yet effective pose that can be integrated into any practice to enhance overall well-being. Today, we're focusing on yogic breathing, which is a powerful combination of 3 types of breathings. This is a preparatory practice that will do for 7 days to set a strong foundation. First, let's talk about abdominal breathing. This is often called diaphragmatic breathing, where the belly expands as you inhale and contracts as you exhale. It helps activate the parasympathetic nervous system, promoting relaxation and reducing stress. Next, we have thoracic breathing. This involves the chest area, where you expand the rib cage during inhalation, allowing for a deeper breath that engages the lungs more fully. It's especially useful for increasing lung capacity and oxygen intake. Lastly, clavicular breathing focuses on the upper chest and collarbone area. It involves lifting the shoulders slightly during inhalation, which helps access the upper lung regions. While it might seem more superficial, it plays a vital role in complete breathing. Combining these 3 types creates a balanced, full-body breath that enhances overall vitality and mental clarity. Remember, these practices are foundational, so consistency over the 7 days will help you experience their full benefits and prepare you for more advanced techniques ahead. Welcome to this section on Nadi Shodhana Pranayama, which is essentially about purification of the psychic network. Now, this technique is a powerful practice aimed at balancing and cleansing the subtle energy channels within us. For this particular technique, we start with a preparatory phase that lasts for about 15 days. During this period, it's important to focus on developing consistency and awareness. Think of it as laying a strong foundation before diving deeper into the practice. The key points here are patience and regularity, as these help in gradually clearing the energy pathways. As we progress, you'll notice how this practice can enhance your mental clarity, emotional stability, and overall well-being. Remember, this is not just about physical breathing, but about tuning into the subtle currents within us, aligning the entire psychic network. So, take these initial days seriously, as they set the stage for more advanced benefits to come. Let's take a closer look at Ujjayi Pranayama, often called the psychic breath. This breathing technique is really fascinating because it involves a gentle constriction of the throat, which creates a soft, whispering sound as you breathe in and out. This sound isn't just a side effect. It actually helps focus the mind and deepen your awareness during practice. The key point here is that Ujjayi is not just about breathing. It's about harnessing the breath to cultivate inner calm and mental clarity. When practiced regularly, it can serve as a powerful tool to support your overall yoga journey, connecting breath, body, and mind seamlessly. By emphasizing slow, controlled breaths, Ujjayi helps regulate the nervous system, reducing stress and promoting a sense of stability. This technique aligns perfectly with the broader goal of our practice, to cultivate mindfulness and inner balance. So, as we explore this method, remember that the psychic breath is more than just a breathing technique. It's a way to tap into a deeper level of awareness and presence, which is central to our overall theme of self-discovery through yoga. Let's take a moment to explore two powerful breathing techniques: Kapalbhati pranayama, also known as the frontal brain cleansing breath, and Bhastrika pranayama, which is often called the bellows breath. Both of these practices are excellent for energizing the mind and detoxifying the body. Starting with Kapalbhati, this technique involves rapid, forceful exhalations that help clear the frontal regions of the brain, enhancing mental clarity and focus. It's like giving your mind a fresh start, removing mental clutter and increasing alertness. Moving on to Bhastrika pranayama, or the bellows breath, this involves deep, vigorous inhalations and exhalations that stimulate the respiratory system and energize the entire body. It's named after the bellows used in blacksmithing because of the powerful movement of breath, which boosts vitality and clears stagnation. Both practices are integral to our overall theme of breath awareness and mind-body connection. They serve as tools to not only improve physical health, but also to cleanse and sharpen the mind, preparing us for deeper states of meditation and awareness. Remember, consistent practice can make these benefits more profound and lasting. Now, let's talk about Bhramari pranayama, also known as the humming bee breath. This is a powerful breathing technique that involves making a humming sound during exhalation. The key point here is that it helps calm the nervous system and reduce stress. When we practice Bhramari, we gently produce a humming sound like a bee, which creates vibrations that have a soothing effect on the mind and body. This practice is especially effective for calming anxiety, improving concentration, and promoting mental clarity. It's a simple yet profound tool that connects well with our overall theme of stress management and mental wellness. By incorporating Bhramari pranayama into our routine, we can experience a quick and natural way to bring balance and tranquility into our day. Remember, the focus is on gentle, mindful breathing and the calming vibration of the hum. Let's take a look at some relaxing asanas that help us unwind and restore our energy. Starting with Matsya Kritasana, also known as the flapping fish pose. This posture is wonderful for calming the nervous system and improving flexibility in the spine. It involves gentle movements that mimic the flapping of a fish, which promotes relaxation and mindfulness. Next, we have Shavasana, the classic corpse pose. This is often considered the most important pose for relaxation in yoga. It allows the body to fully rest and integrate the benefits of the practice. When we practice Shavasana properly, we can experience a deep sense of calm and mental clarity. These poses are essential components of a relaxation routine because they help us release tension, reduce stress, and prepare the body and mind for a peaceful state. Remember, relaxation isn't just about physical ease, but also about cultivating a state of mental calmness that supports overall well-being. Let's take a closer look at Sukhasana, also known as the easy yoga pose. This pose is fundamental for cultivating a comfortable seated posture, which is essential for meditation and breathing practices. It's a gentle way to begin calming the mind and preparing the body for deeper practices. Moving on, we have Ardha Padmasana, or half lotus pose. This posture involves crossing one foot over the opposite thigh, providing a slightly more advanced seated position. It helps to open the hips and deepen your meditative stability. Next is Padmasana, or full lotus pose. This is a classic seated posture that promotes stability and openness in the hips, making it ideal for prolonged meditation sessions. It requires flexibility and patience, but offers significant benefits for focus and energy flow. Finally, we come to pranayama poses. These are specific breath control techniques that are integral to yoga practice. They help regulate and deepen your breathing, which in turn calms the nervous system and enhances your overall sense of well-being. Incorporating these poses complements the physical postures and supports your mental focus. Overall, these poses form a continuum, from simple seated positions to more advanced postures, and they all serve to prepare both the body and mind for effective pranayama and meditation. They highlight the importance of alignment, comfort, and breath awareness in your yoga journey. Today, I want to introduce you to Padmasana, commonly known as the lotus pose. This is a classical seated posture that symbolizes purity and spiritual awakening in many traditions. It's not just about flexibility, it's about achieving a deep sense of stillness and focus. Next, we have Ardha Padmasana, or the half-lotus pose. This variation is often used as a preparatory posture or for those who may find the full lotus pose challenging. It allows you to access many of the same benefits, calmness, stability, and openness, while making the pose more accessible. Both poses are integral to meditation and breathing practices, helping to align the body and mind. They connect to the overall theme of finding balance and harmony through yoga. Whether you're sitting in full or half lotus, the key is to approach these poses with patience and awareness, embracing the journey towards greater inner peace. Let's take a closer look at Mula Bandha, which involves the contraction of the perineum. This technique is fundamental in many practices because it helps activate and stabilize the pelvic floor. When we engage Mula Bandha, we're essentially lifting and drawing up the base of the pelvis, which can improve core stability and even influence the flow of prana or life energy through the body. Now, moving on to Uddiyana Bandha, which is a standing abdominal contraction. This is a slightly more dynamic lock where you draw the lower abdomen in and up towards the diaphragm. It's often practiced in a standing position and can energize the core while also helping to regulate the flow of energy and breath. Both of these bandhas, Mula and Uddiyana, are vital tools for controlling the mind and body, connecting us more deeply to our internal awareness. When integrated properly into our practice, they support overall stability, focus, and energy management. Remember, the key is to engage these bandhas gently and consciously, always respecting your body's limits and sensations. These techniques are like internal locks that can enhance your practice and bring a greater sense of balance and control. Today, I want to talk about Mahabandha, which is often called the Great Lock. This is a powerful combination of 3 specific bandhas or locks that work together to energize and stabilize our practice. The first one is Jalandhara Bandha, also known as the throat lock. It involves gently tucking the chin towards the chest, which helps control the flow of energy and stabilize the neck area. Next, we have Uddiyana Bandha, or sitting abdominal contraction. This is about drawing the abdomen inward and upward, creating a lift and supporting the core. When we combine these with Mahabandha, it creates a strong internal lock that enhances our focus and energy. Remember, these bandhas are not just physical gestures. They are tools to direct vital energy within us. When practiced correctly, they help us deepen our breath control, improve concentration, and support our overall meditation and yoga goals. So, understanding and applying Mahabandha really ties into the overall theme of harnessing internal energy and achieving greater awareness. Let's take a closer look at the physiological changes that happen during the fight or flight response. First, you'll notice that breathing becomes shallower and more rapid, which helps to quickly supply oxygen to your muscles and brain. At the same time, blood vessels in the core of the body constrict, directing more blood flow to your arms and legs so you're prepared to act. Your heart beats more rapidly, rushing blood to those key areas, and as a result, blood pressure increases. This combination prepares your muscles to either confront the threat or escape from it. You might also feel your muscles tense up, ready for action. Meanwhile, your adrenal glands secrete stress hormones like cortisol and adrenaline, which amplify this state of alertness and energy. Your brain shifts into a hyper-alert mode, enhancing your awareness of your surroundings. The hypothalamus also releases endorphins, which are your body's natural painkillers, helping you to endure any pain or injury during this intense moment. On the other hand, some systems slow down. For example, your immune system gets depressed, and your digestive system essentially shuts down, conserving energy for the immediate threat. All these changes work together to prepare you physically and mentally to face or flee from danger, demonstrating how remarkably your body responds to stress in critical moments. Now, let's explore the physiological changes that happen when the relaxation response kicks in. First, you'll notice that your heart rate decreases, which means your heart is beating more slowly and calmly. Along with that, your blood pressure lowers, helping to reduce overall strain on your cardiovascular system. Your breathing rate also slows down, becoming deeper and more relaxed, which improves oxygen exchange. Speaking of oxygen, consumption decreases, meaning your body is using less energy, promoting a state of rest and recovery. You'll also see a drop in stress hormones in the bloodstream, like adrenaline and cortisol, which are responsible for the fight-or-flight response. This hormonal reduction is key in calming the body down. Muscle tension and constriction lessen too, easing any physical tightness or discomfort you might feel. Blood flow shifts back toward your core organs, supporting essential functions and restoring balance. Finally, your brainwaves change to calmer, slower patterns, similar to those seen during deep relaxation or meditative states. These changes collectively reinforce the overall theme of the relaxation response, a state of deep, restorative calm that counteracts stress and promotes well-being. Let's explore the recommendation I have for moving forward. Universities, colleges, institutes, and hospitals should collaborate to establish a dedicated yoga research lab. This lab would focus on showcasing the results of yoga on neuromuscular activities, which is crucial for gaining the trust and confidence of doctors, patients, and even laypeople. When people see clear scientific evidence, it becomes much easier to promote yoga as a reliable therapy. Now, it's important to emphasize that yoga is an effective, priceless therapy with no side effects. Although it originated in ancient India, unfortunately, this fact is often overlooked or even considered shameful in some circles. Interestingly, in Western countries, there's a lot of scope for yoga and dedicated research, and they are pursuing this very sincerely. Sadly, in India, this potential isn't being fully harnessed or promoted as it should be. So, my suggestion is that universities should send out a specially designed yoga intervention program to all centers. This way, we can help more people without any additional expenses. By doing so, we can address many health problems more effectively and make yoga accessible to a larger population. Essentially, this approach can help us solve many issues and promote yoga's benefits more widely and systematically. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Being grounded is such an essential part of navigating both our personal and professional lives. When we talk about being grounded, we're really emphasizing the importance of staying connected to ourselves, our values, and the present moment. It's about maintaining stability and resilience, especially when things get challenging or unpredictable. This concept helps us stay focused and clear-headed, which is crucial for making thoughtful decisions and maintaining authenticity. In the context of this presentation, being grounded ties back to the overall theme of growth and balance, because no matter how high we aim or how fast we move, staying rooted keeps us steady and aligned with our true purpose. So remember, staying grounded isn't just about staying calm. It's about being aware, centered, and intentional in everything we do. That way, we can navigate change with confidence and integrity. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a look at the global impact of yoga. When we think about yoga worldwide, it's clear that it's more than just a physical practice. It's become a movement that transcends borders and cultures. Yoga's popularity has grown exponentially, with millions of people embracing it for its health benefits, mental clarity, and sense of community. This global reach underscores how interconnected health and wellness are becoming, regardless of where you are in the world. It also highlights the importance of understanding diverse perspectives and practices within yoga, which enrich the overall experience. Ultimately, the worldwide adoption of yoga supports our overarching theme, the universal pursuit of well-being and self-awareness. Yoga for one earth and one health. This slide really underscores the deep connection between our well-being and the health of our planet. When we practice yoga, we're not just focusing on physical postures or mental clarity. We're also embracing a philosophy that promotes harmony with nature. It's about recognizing that the health of the earth directly impacts our health and vice versa. This holistic approach encourages us to live sustainably, be mindful of our environmental impact, and foster a sense of global community. Ultimately, it reminds us that caring for ourselves and caring for our planet are two sides of the same coin. By integrating these principles into our daily lives, we contribute to a healthier, more balanced world for everyone. This slide doesn't contain enough information. That's why we're moving to the next slide. And here we are at the final slide, the home of Om, yoga. Your journey begins today. This is more than just a closing slide. It's an invitation. It's an invitation to embrace yoga as a lifelong practice, a path that can bring balance, peace, and strength into your life. Remember, your journey starts right now, at this very moment. Whether you're new to yoga or returning to it, each step you take is a step toward greater awareness and well-being. So take this inspiration, hold on to it, and let it propel you forward. Your journey begins today, and the possibilities are endless.